On the Gold Coast, a distressed puppy is being rushed in.
Oh, he's shaking, little chap.
And Dr. Alex urgently needs to find out what's happened.
What's your puppy's name? Hendrix. Hendrix.
The puppy has been viciously attacked by an 80-kilogram bull mastiff. His owner Melissa was so badly injured trying to break up the fight, her sister Alexandria has had to take over and get treatment for Hendrix.
She's so concerned about her puppy. She didn't care about herself. She didn't even want us to take her to the hospital. She was like, just take the puppy to the vet.
On talking to Alexandria, I find out more of the real story. Melissa, who is Hendrix's owner, is in hospital. She tried to get Hendrix out of the jaws of the other dog.
It's all right.
She's been badly injured and she might even lose a finger. I can only imagine how frightening that experience must have been, but it just shows you what people will do in that situation to save their pet. And it just pinned him down? Or...
Oh, we don't know.
God, that must have been traumatic for you. You did really well to get here. And what we're going to do with little Hendrix now is give some pain relief. We need to try to get him to feel a little bit better, and he's shaking and in shock at the moment. Let's assess his injuries and then we can work out what we're going to need to do to help him. All right?
I think I'm still a bit in shock. I wasn't expecting to hear my sister scream like that. I don't think it's registered yet. The whole thing about what's gonna happen to my sister. I don't know if she's okay. I don't know. We just left her and brought the puppy here.
This is such a challenging situation to be faced with. I've got a really upset family, a traumatised little puppy, and the possibility of an unknown number of injuries.
Good man, he's a good boy.
In Bondi, Sue and Maritza have arrived with two sick rescue cats, brother and sister Boho and Tiny.
You can see her eyes glazed over.
We're worried because they've got symptoms like runny nose, runny eyes, sneezing, a bit of coughing, and they're just a bit grumpy. Yeah, poor little things.
Hey.
The 12-month-old siblings were found as kittens, dumped at a local cemetery. Both were suffering debilitating cat flu that they haven't been able to shake.
Hello, you guys.
Hey,
how are you?
Good to see you.
Yeah, you too.
Thanks for seeing us.
Good to see you both again.
You too. Mwah.
Who have you got for me here?
Tiny and Boho today.
Okay.
Chronic flu.
Right.
Yep.
Let's go check them out.
Okay. Excellent.
These cat carers are just priceless. They're absolutely unbelievable. They day in, day out rescuing cats. They see the worst of the worst cases. So now Boho is the boy?
The boy, yes.
Okay.
Yeah. He's got a running.
They're gorgeous.
Let go of me, darling.
Hello.
And I'll get Tiny out of here. Come on, sweetie.
So let's have a look at them.
Okay.
So he obviously gets quite weepy eyes.
Yes.
He's actually got some chronic damage to the cornea, presumably caused by feline herpes virus or the cat flu.
Yeah.
Kate needs to put a special dye in Boho's eye and take a closer look under ultraviolet light.
What we really want to establish here, is this an ulcer or is this a scar?
An untreated ulcer could lead to blindness.
But I can see he's a pretty sick little cat.
I think we just start with some vital signs.
Yeah.
Then we'll go over and see if we can work out exactly where he's been attacked.
On the Gold Coast, 3-month-old Hendrix has been savagely attacked by an 80-kilo mastiff. His distraught owner Melissa is in hospital with severe wounds after trying to break up the fight.
Oh, his heart's racing. I really think that's just got to be the shock.
Now that the distressed little pup has been given pain relief, Alex and vet nurse Kate can start taking a closer look at his injuries.
Let's try and get this collar off if we can. Really want to check him all over, see exactly where these puncture wounds are and how bad the damage is. Oh, it's okay. It's okay. See them, hey?
Stand up, please.
Yeah. He really doesn't want to stand up, does he? Let's have a look under here. Hey. Little ones here, but they're very superficial. They don't even fully go through the skin by the look of it. I'm looking over Hendrix and I'm seeing some red marks, but I'm not seeing any deep puncture wounds. And that's surprising because Alexandria is telling me that Hendrix has been attacked by a much bigger dog. Yeah, I'm thinking we're actually going to have to clip his hair off to make sure that we're not missing them because I can't see them. Oh, what's that? I'm just going to clip that hair away from that area. Oh, there we go. There's wounds there, but they're not full thickness puncture wounds. You can never be complacent with dog bites. We're going to need to clip further and make sure that there's not more damage there. Here are your bite wounds.
Good girl.
In Perth, Reese and Annika have brought in their 6-year-old Border Collie Aspen to see Dr. Peter Ritchie.
That's it.
Hey, mate. How you going, buddy? And this is Aspen. Hello,
Yes,
Aspen.
Aspen.
Hey, sweetheart.
We got Aspen when she was 9 months old. She's usually pretty healthy. We just noticed her eye was a bit irritated. It was just watering a fair bit, and we thought it was a scratch originally, and then it just didn't seem to get any better. Just kept irritating her. Unfortunately, she's got grass seeds stuck behind her eye, embedded in the skin.
With grass seeds, depending on where it goes, they do tend to go down behind the third eyelid,
Yeah.
typically. Is that where you saw it go, like, towards the nose?
Yeah, so it's like in the corner,
Yeah.
behind the eye.
Aspen's got a grass seed stuck in her third eyelid. This definitely could be something a bit more serious than it first looks. Grass seeds tend to be nasty. What I'll do is, no, sweetie. I'll put some local anaesthetic in her eye so that it will numb it, and then hopefully with that I'll be able to retrieve it out. Often they actually ulcer the eyeball as well, so I'll stain her eye and have a look at that and just see if there's an ulcer or not. If the grass seed's been there for a couple of days, then we have potential for significant trauma and life-threatening infections. If it's a bit more complicated than that and we need to give her a sedation, I'll come and have a chat to you, but hopefully we can just do it with local. So, yeah. I know, sweetie. You're beautiful.
She's pretty tough. She never complains when she does hurt herself.
Let's go, Aspen. Come on. Come through.
Obviously, she's in a bit of pain, so she's probably realising that we're trying to help her. So hopefully it's not too difficult and hopefully it's not too uncomfortable for her.
Good girl. All right, so I'm just going to put some local anaesthetic eye drops into her eye. So that should numb her eye in a little bit.
All done.
So I think the local anaesthetic's starting to take effect now because she's opening her eye a little bit more. Now I'm able to get a really good look at Aspen's eye. I can see that in her third eyelid, there's a nasty grass seed poking right into it. It's clearly causing a lot of pain and there's a little bit of blood coming from it as well. All right, so I can see the grass seed is just attached to her third eyelid there. I really need Aspen to stay still so I can remove the grass seed out without causing any injury myself. If she moves around while I'm poking tweezers into her eye, that could be quite risky. I know, sweetie, it's okay.
There you go, little mate.
In Bondi, Kate is worried about rescue cat Boho after he was brought in with his sister by rescuers Sue and Maritza.
So he's going to have a little fluorescent eye, and what it does is it just lets us look for damage on the cornea.
Yep.
Both siblings have been battling ongoing cat flu, which can often lead to nasty eye ulcers and long-term damage.
And lets us be able to establish if we actually need to treat that ulcer.
Okay.
So what we can see here is that there's actually not a great deal of fluorescein uptake in that eye. So this is actually a scar, right, over the cornea. It looks like it has been an ulcer at some point and it's actually resolving. There is, however, some secondary conjunctivitis in these eyes, right? So we still do need to use some antibiotics to sort that out. It's a real uphill battle for rescue cats. These things reoccur, they get sick, they get skinny. It's just a vicious cycle. Cat flu affects the ability to be able to smell, right? And without the ability to smell, they just don't eat very well. So trying to keep his weight up is going to be a bit of an ongoing battle.
Okay.
Find something you really like.
Yeah.
Roast chicken.
Roast chicken.
Or smelly fish. Smelly fish.
Swap.
Swaps.
Swaps.
Swapsies.
Hello, beautiful. How are you?
She's tiny, isn't she?
She's a lot more chilled than what he is.
Yes.
Like her brother, Tiny has also been battling cat flu most of her life.
You can also see that little left nostril is just so snotty. She can't smell.
No.
Right? Oh, dear. Gosh, Gosh, that's a bad eye, isn't it?
You should have seen it when I found her.
I can't actually see that there is anything actually wrong with those corneas, which is great. You do actually notice a prolapse of that third eyelid. So the virus has at some point really damaged those eyes. It's been an ongoing battle to get these two little guys over their cat flu. Today what I'm going to give them is some antibiotics, and we're going to also send them home with some antiviral medication. It's really strong. It's a lot stronger than what they would have used before, and I think this is going to be the thing to kick it. 20 days of antibiotics.
Okay.
I know it's a long
That's all right.
stretch.
Sounds like they need it, absolutely.
You know, these guys have been sick for a really long time.
Yeah, that's right.
They've got really chronic infections, and we really want to try and actually get on top of it. I'm not sure that Boho and Tiny are ever going to find long-term homes, but Maritza has a real soft spot for these two. She's cared for them since they were tiny, and I reckon that they've probably got a home for life.
You're a good boy.
I think we really want to clip up this area here because this is where I was really worried.
On the Gold Coast, Alex and vet nurse Tiffany are urgently trying to find any puncture wounds on dog attack victim Hendrix.
Can you clip that hair off?
Oh yeah, look at that.
Yeah, that's a tooth mark. That's just gone right through. We're definitely going to need to look into that, clean that out. There's a deep puncture wound from a tooth, and that fits in with exactly what Alexandria's been telling me, which was that Hendrix was bitten across the stomach by the big dog.
12-week-old Hendrix was viciously attacked by an 80-kilo bull mastiff.
One thing I'm worried about is whenever you've got one puncture wound, there's often another one the other side of the bite.
From that full grab, both sides.
Yeah. So we're going to have to keep looking and see if we can find any more.
Just need to do a little bit on your
want me
other
to roll him
side,
over?
baby. Look at that bruising already.
Yeah, you can actually see that. Can you see that, where that's all swollen? Big concern with dog bites is that if a tooth pierces through into a body cavity, it can damage organs, it can set up nasty infections. That's what we're really worried about. I think that's the other side of the grab.
Where he's grabbed him?
Yeah, he's got one tooth in there. This one hasn't actually broken the skin, but he's lifted that whole area off.
So bruised.
Yeah. This means that we're going to have to anaesthetise Hendrix and surgically explore this wound to see how deep it goes. Will you go over?
There you go, little monster.
In Collaroy, wildlife volunteer Joan has two little patients to see Dr. Lewis Hunt.
In here we have two wombat joeys. They're about 5 to 6 months old.
Both baby wombats were orphaned and brought to Sydney Wildlife to be reared by carer Joan.
My little babies, you won't see much with all the
not
bags.
much going on there.
We'll have to get them out for you to have a check.
That's good.
It's very rare that I get to see wombats at this age. It's a fantastic opportunity to have a look at them. They're gorgeous little things.
So this is Wanda. So she's really gorgeous, isn't she?
She's amazing,
She's just the
hey?
most beautiful little baby.
Yeah, so at this age, they're normally well and truly in their mother's pouch. And obviously it's sad that we're seeing them because it means their mum didn't make it. But, you know, without Joan's incredible effort, you know, at least we can get these guys hopefully back to the wild. They're just amazing. I mean, look at them. They are so cute. And obviously already you can see these adaptations designed for digging their burrows and all that sort of thing.
A quick check on the scales will indicate if the wombats are gaining the correct amount of weight.
There we go, 16 grams. And there we go, Wanda, what are you? 1.42 minus 6 kilos, hey?
A dehydration check is also very important for these delicate little babies.
So we're just checking she's not dehydrated, so we just do that by just feeling behind their eyes, making sure that that's not sunken there. So that all looks good, and she's been well otherwise.
Yeah, she hasn't been too bad.
There we go, sweetheart. Let's get you back into your pouch, hey? We certainly don't want to keep these guys out of the pouch too long. The last thing we want to do is stress them out, but obviously we do need to check them over.
With Wanda getting the all clear, it's time to have a look at Waldo.
And he's got a bit of a sneeze.
At this age, these guys can be really susceptible to infections, and if if it is something nasty, they can go downhill really rapidly.
Good girl.
In Perth, Border Collie Aspen has been brought in with a nasty grass seed embedded in her eye.
It's okay, Bobby.
Peter is worried about the deadly implications if he can't get it out.
Eventually they can migrate into places like in the chest, in the lungs and around the heart and cause infections that can kill the patient. I know, sweetie. And I'm just going to gently try and remove it.
Okay.
There we go. And there it is. Pretty nasty thing to have in your eye. If it had been in there for a couple of days, definitely an infection would have set in by this point and there would have been significant trauma to her eye. So we're just giving her eye a little clean now. Little girl. So well behaved. Now that I've got the grass seed out, I want to stain her eye because the grass seed itself may have rubbed against her eyeball and caused a corneal ulcer, so the outside layer of her eye. Good girl. So there's actually no uptake on her eyeball at all, so that's a really good sign. It means, oh, hang on, that there is a hole in her cornea.
Alex has uncovered troubling bruising on dog bite victim Hendrix. She's now starting to fear the injuries under his skin might be extensive.
The first thing we're going to do is ultrasound Hendrix and make sure there's no evidence of internal bleeding with this kind of trauma. So just looking up under the diaphragm, around the liver. All I'm looking for is any free fluid. Generally in a trauma patient, if you're seeing free fluid in the abdomen, it's blood. The good news is at this stage, I'm not seeing anything like that. So hopefully we've got nothing to worry about internally, and we've just got to deal with these wounds. That looks really good, actually. It's good news, the ultrasound's clear and there's no evidence of internal bleeding. So now we're going to anaesthetise Hendrix and surgically explore this bite wound, see how bad it really is.
When Hendrix was rushed into emergency, it was with his owner's sister. Owner Melissa was so badly injured in the same dog attack, she's still undergoing treatment in hospital and has been desperate to find out what's happened to her beloved pup.
Hi, is that Melissa?
Yes, it is.
Hey, Melissa, it's Dr. Alex Hynes here. I'm the vet that's looking after Hendrix. He has got one puncture wound in particular that we're going to need to treat surgically.
Is it the one on the tummy that's bad?
Yeah, it's the one on the tummy that we're most concerned about.
I knew. That's when I panicked, when he got him on his belly.
Yeah, I'm hoping that the big dog has just picked up a whole heap of skin and that's
not
where...
like anything internal.
That's right, yeah, exactly.
Yeah, okay.
So, how are you doing?
I'm at the hospital because it might have gone through my middle finger. Like, I've got bite marks on all of my fingers. I'm trying to pull his mouth open.
Wow, Melissa, that was incredibly brave to put yourself between the big dog and Hendrix.
I'm just wanting him to be okay.
Yeah, I'll give him a big hug for you, okay? You take care, Melissa.
Thank you. Bye.
Poor Melissa, I just feel so sorry for her. She's worried about herself. Her hands have been badly injured, and now she's also got to worry about Hendrix.
And there it is. That there is a hole in her cornea.
In Perth, Peter has just removed a large grass seed from Aspen's eye and must now find out how much damage has been caused by the sharp seed.
So just in the bottom right-hand corner, you can see as she moves her eyeball across, there's that little bit of green uptake. That is a corneal ulcer.
If an ulcer is left untreated, Aspen runs the risk of serious infection or even blindness.
It's only quite small and it should heal quite nicely, but considering how big that grass seed was, it's definitely going to be causing her a little bit of grief for the next few days. So I'm about to give Aspen an injection of a painkiller, anti-inflammatory. She'll go home on this medication for the next few days as well. This will help with the pain associated with that ulcer in her eye. Come on, Aspen. You can go home. Come on. Come on, sweetie. How you going? So it all went really well. So yeah, she's had the grass seed removed. Seeing Reese reunited with Aspen is a really good feeling. They're clearly happy to see each other. Reese was very worried about her and the grass seed in her eyes. Obviously quite traumatic for him to see Aspen with that. As far as damage to her eyeball goes, there's only a small area of an ulcer there. Okay. Nevertheless, there is an ulcer, so we need to send her home with some pain meds because they're usually quite painful. Should be basically problem solved now that it's out. And
that's great.
Hopefully with these medications, it'll keep it that way.
Yeah, so, wicked.
Oh, she's winking at us.
Yeah, thank you.
Poor girl. All right, I'll leave you to it. Nice to meet you. This is one of the most satisfying things about being a vet.
Hello, Waldo. Sweetheart, look at you. So they're not brother or sister, are they?
No, but we try and pair them up so that they'll do better together.
Yeah.
Because we want them to go back to the wild. That's what we aim for, not to be pets.
In Coleroy, Lewis is about to give the second little wombat, Waldo, his checkup.
There we go. Good Waldo, hey? 1.37, so about 10 grams heavier than Wanda. Any nasal discharge that you've noticed, any?
Yeah, it's just been sneezing.
Good boy, Waldo, hey? Heart and lungs all sound good. I wouldn't be too worried about that sneezing. Certainly, he looks very bright, happy, energetic and inquisitive. There's no signs of any dehydration there. So at this stage, I just keep an eye on that.
The wombats are given a clean bill of health, but it's now their scheduled feeding time, and Lewis is getting a chance to help.
Is there any tricks to this?
Not really, just put it inside of the mouth.
Here we go.
He may not feed for you because they get used to one person, and so be a bit tricky.
Oh.
It's not as easy as it looks, Lewis.
They do tend to bond to one person only, so I think I'm going to struggle here today.
Friend, are you ready to go off to sleep?
On the Gold Coast, Alex and vet nurse Tiffany are about to perform surgery on 12-week-old Hendrix to clean up nasty bite wounds inflicted by a massive bull mastiff.
I want to make sure it doesn't penetrate into a body cavity, but I also need to clean out any infection out of the wound. What I'm going to do now is explore these bite wounds that I've found so far and make sure that it doesn't go into the chest cavity. While he's asleep, we'll go over him from head to tail, make sure we haven't missed anything. These ones under his neck, they look really superficial, but I said that before. You never know. And we found that puncture wound, didn't we? So I reckon we take all of that hair off.
And see what's under there?
Yep. It almost looks like he's been scratched there, Tiff. It's just, that's nasty abrasions there, but there's nothing that goes full thickness through the skin. It would be quite painful.
Satisfied there are no more puncture wounds, Alex begins to explore the bite on Hendrix's abdomen.
You see that? I think I'm just going to make an incision, open that up and see what's underneath. It's really important to open up bite wounds because we don't know what's underneath. There could be hair, saliva, dirt. If I leave that behind, it's going to lead to a nasty infection.
How far does it go?
It looks like it's just the muscle, which is great. The major puncture hole that I was worried about, it doesn't go anywhere other than into the muscle. It doesn't go into the chest. That was my biggest concern. This is great news for Hendrix. It means he won't need any major surgery. I think he'll be fine. Okay. Yeah, it's great. Okay, let's close this down.
But just as they're about to close, Hendrix begins to take a turn for the worse.
Can we just do a Doppler on this dog? Yeah.
In Coleroy, Lewis is trying to feed baby wombat Waldo, and it's not going well.
If he's not going to take it from you, because I'm mum, I can feed him.
Joan made it look very easy with Wanda. Wanda sort of had that bottle without any issues, and Waldo was very unimpressed.
I'll swap you.
Yeah, there we go, Joan. The expert's going to take over and show me how it's done.
Hopefully.
Well, I'd say definitely. Here we go.
There you go. Got it? Got that
All
one?
right, yeah, I've got little Wanda here.
What I'd really like to see for these two wombats is that they get released back out into the wild and just be happy, healthy wild wombats.
Joan's an expert at rearing wildlife. I'm really hopeful that we will see Waldo and Wanda released back into the wild, and hopefully that they can bring up baby wombats of their own.
Moment of truth, Tiff.
On the Gold Coast, Alex and Tiffany are trying to finish Hendrix's procedure as soon as they can to avoid complications. But his blood pressure is dropping.
Just gone from 72 to 57.
Hendrix's blood pressure has been dropping under anaesthetic. Nothing too serious, but every anaesthetic carries a risk. And the sooner we can wake him up, the better.
You need to stitch up and get out of there.
You okay? Come together pretty nicely.
That's good.
It's time for you to wake up, my friend. Pop you back to bed and have a good night's sleep. Hopefully your mum's having a good night's sleep as well. It's been a rough day for everybody, I think. You're gonna wake up. Oh, now put powder on you.
You're okay, baby.
Hey, lady. You're awake. Hopefully when he wakes up, he'll just think it's all a bad dream.
Like a horrible nightmare. I hope he doesn't remember.
We know that Hendrix is going to be okay physically. What I don't know is psychologically what the damage can be. When puppies are attacked like this, it can really traumatise them, and it can affect how they interact with dogs later in life. Good boy.
Good boy. Come on, darling, here we go.
In Bondi, Dimitri is arriving at the practice with Border Collie Bernie for an appointment with Dr. Kate Adams.
I'm Bernie's dog nanny. Normally I take Bernie out in a wolf pack 5 days a week with other dogs, and we have a great time socialising and having exercise.
But Bernie has been in the wars.
Well, his mum rang me this morning a bit panicked, saying that he had a sore or a wound on his neck. She had to go to work, so she asked if I could bring him in, and I have. So we'll see what the vet says.
Hello. Hey, Bernie dog.
I'm Dimitri, I'm Bernie's nanny.
Have you got your nanny with you today, huh?
I haven't ever heard of anyone with a dog with a nanny. It's the first one for me. Dogs are really social creatures. They need humans. So I get lots and lots of really doted on pets, and I love that. What's wrong with you today?
Well, I think he maybe got bitten by Victor.
Oh, no.
Bernie's got a best mate in the wolf pack, and they're always constantly pulling at each other. Now, he's got an abscess underneath his neck there from all the rough play.
Oh, Bernie.
Come on, let's go have a look at you.
Cool. Come on, young man.
Dimitri thinks that maybe there's been some kind of an altercation. Come on, you guys. So could be there's some kind of a wound there. Do you know much about his history?
But I know that he was a rescue dog in California, so she got him from a shelter.
Let's just give him a bit of a check over first. I know, Bernie dog. Don't worry.
Good boy.
What's this one here? So now you take him to the park.
Yep.
You're his full-time nanny.
Yep.
And it'd be like having a whole class full of primary school-aged children.
It's worse.
Really?
They're faster.
So we can't really see very well just because he's such a furry little dog. We're going to actually clip up that area and we're going to give it a good clean so we can get a better look as to actually what we're dealing with here.
Nurse Francesca will be assisting Kate.
And you can see he's quite anxious, so I'm trying to sort of reduce his anxiety as much as absolutely possible. I know it hurts, Sugar. I know it hurts. It's okay. So unfortunately, dogs don't know that what I'm trying to do here is actually help him.
It's all right, Bubba.
I know, darling.
It's okay.
I know, darling. Poor old Bernie, I know that he might find clipping a little bit distressing, but I do need a clear view of that wound. He just feels like this is really sore.
It's okay, look. There we go. Just relax.
Oh, that looks sore. It does, doesn't it?
I can't yet tell exactly what's caused this wound, but I can see that it's infected. There's a whole bunch of pus underneath that skin, and it can be really painful. This is obviously by the hour really getting worse, and you can see that Bernie's very distressed about this. If left untreated, this infection is just going to enter the bloodstream and Bernie is going to become one sick dog.
It's not good, is it?
In Melbourne, Karen and son Xavier are arriving at the Kingston vet practice with their Labradoodle Molly and new addition to the family, St Bernard Crunch.
Good boy, Crunch.
Molly's a clinic regular, but this will be the first time Dr Danny Dusek is meeting big, lovable 4-year-old Crunch.
Hello, this must be Crunchy Boy.
We've had Crunch for about 2 months now, and yeah, they've been a very exciting 2 months. I love them so much.
Oh, you snobs, aren't you, eh? Oh, you're beautiful.
He got your arm.
He does that a lot.
Crunch has just covered me with his slobber love, but there's certainly a lot worse I have to deal with, so that's okay. All right, well, we might pop Crunch on the scales and see what he weighs in at today, eh? That's a boy.
Onto the scales.
Up you pop.
Good boy.
Well done. Oh my goodness. So we're I'm gonna say 69 kilos, you big boy, hey? Don't think I'll be picking Crunch up onto the table today. Yeah, I think we'll leave him on the floor. Just a teddy bear, aren't you?
Crunch came to us from another family who had had him from a pup, but then they had returned to full-time work after having a young child and felt they couldn't give him the attention that he needed. So, yeah, we're very lucky to be the ones who could rehouse him.
Crunch has come to the clinic to see Danny for his yearly vaccination, and Molly has come along to keep him company.
All right, Crunch and Molly, come on through. Molly girl, you're such a sweetheart. All right, we're gonna try sit you up, okay, mate? Hey? Get under that chest of yours. Up your pop, mate. Up your pop.
As it's Crunch's first visit to the clinic, Danny begins with a physical examination.
Let's have a little look at you now, all right, mate? Now let's have a little look at these beautiful ears now. They don't look too bad. Now I'm just gonna have a feel of this leg. Yeah, well done. Oh, you don't mind about that. Have you noticed any limping or lameness at all?
No.
No? That's good. I'm just having a look at Crunch's elbows and hips. They're really important, particularly in your large and giant breeds because of hip and elbow dysplasia, and St Bernards do tend to be a bit more overrepresented as far as those disease processes go. It's possible that he could have a bit of mild discomfort going on in his hips that we're not seeing when he's exercised. Yeah. But just keep an eye on it for now.
Sure.
Alrighty, let's have a little listen to your ticker, hey? St Bernards can get heart disease. But Crunch's heart sounds beautiful. We've got no evidence of any murmur or arrhythmia, which is really good. We might do those vaccinations now. So we've got an oral component first and then go for the injection afterwards. Try not to eat my hand while we're there, all right, mate? So I'm just gonna squirt that into your gob. That's away. Oh, very good.
Good boy, Crunch.
Mightn't taste the best, I'm sorry.
With the oral vaccination done, Crunch now needs 3 injections.
All right, let's give some treats. Treats are the best distraction. If you want to be in charge of the treat giving up the front just while I'm giving that, and then he won't even notice.
More treats.
Good boy. The heartworm injection for Crunch is particularly big, so this one might be a little bit more ouchy than the first. Oh, I know, I'm sorry. All right, one last time. Oh, mate, oh, you really cottoned onto that last one, didn't you, hey? I'm so sorry. I think Crunch has landed on his feet with you guys. I think he's going to have a really beautiful home, so...
Thank you.
It's a really generous thing to take on such a big dog. See you, Crunchy boy, you be good now. At 4 years of age, to give him such a loving home like they have, they're just really kind-hearted people.
We'll see you the same time next year.
Will do. See you later. All the best, guys. Bye. Bye.
Hey, my man. Time to go home.
24 hours after being attacked by another dog, Hendrix is well enough to go home. He's being picked up by his owner's sister, Alexandria, and cousins, Alina and Joanna.
I think there's people here who want to see you. Look who's here. As I come into the consult room with Hendrix, there's family everywhere. And Alexandria is actually capturing the moment on her phone so she can share it with her sister, Melissa.
Who's that? Who's that?
He's made an amazing recovery. After one day, Hendrix is looking so much better. He's bright, his tail's wagging and he's giving kisses. It's hard to imagine that yesterday he was brutally attacked. He must be sore, but you wouldn't know it. He's just got so much love to give. He's been getting lots of cuddles, but I don't think it's quite the same as cuddles from his auntie.
Yuck. Yucky. Brian's looking so good. I'm so happy. And I'm so proud of my sister. She was so brave to stand in front of such a big dog. And he wouldn't be here today if that wasn't her bravery.
And really, he's been so happy. I mean, I know we were worried yesterday about whether he'd been traumatised, but honestly, he has been so great today. He's been good even around the other dogs, around all the people. So, you know, I'm hoping that he can just put this behind him.
Really so.
How's Melissa doing, Alex?
As good as he is.
In protecting her puppy, Hendrix's owner Melissa has suffered severe bite wounds to her hands.
That's the thing that's been really stressful today. We don't know that she's going to be okay or if her hand's going to be okay.
She saved Hendrix's life. That's an incredible thing to do. He's a lucky little puppy. I'm sending Hendrix home with a cone of shame. Now it's to stop him getting to the wound, but he's having a little bit of trouble getting used to it.
Hey.
He's exploring.
Hey.
We'll see you later. Hey, you take care, Mr. Frillneck Lizard. You stay happy.
You gotta go and cheer your mum up. That's what she needs now. All right.
Thank you so much.
See you guys. You take care, okay?
Oh, you're stressing.
Just take that off.
At the Bondi Clinic, Kate and vet nurse Fran are examining a nasty skin infection on Border Collie Bernie's neck.
I know, sweetheart, I know it hurts.
In reception, Bernie's dog nanny Dimitri suspects the wound might be the result of rough play with another dog in his wolf pack.
I say the culprit's Victor because those two play 90% of the time together.
Now I've got a clear view of Bernie's neck. I'm able to see that there's not a bite mark and there's no wounds there. It means that Bernie hasn't been bitten by Victor. What we actually call this is a pyotraumatic dermatitis. That's also known as a hot spot, an area of infected skin that's really hot and really, really distressing for animals. They often happen around the collar. It's very, very painful. In Bondi, I usually see this in swimming dogs, dogs that love the water. It's usually caused from moisture, getting underneath the collar and rubbing.
Well done, sweetheart.
So I'm just giving it a really good clean, and we're going to actually start Bernie on some antibiotics. And we're going to get Bernie to not wear a collar for a little while. No collar and no swimming, Bernie. It's a very good thing that they came in this early. If it was left, this infection would just continue to get worse and worse and worse. It would have been a surgical job. This is going to be a little bit sore for Bernie for the next couple of days, but luckily, rescue dog Bernie is not going to need surgery.
Almost done. Almost done.
You know, he's obviously very anxious and this is obviously really sore for him. And he's been such a good dog.
Come here, sweetheart. Come here, Bubba. Sit.
Good boy, Bernie.
Bernie needs an antibiotic injection, and then he can be reunited with nanny Dimitri.
Well done.
Hey, how you going,
glad
buddy?
to see you.
Thanks, Kate. How is he?
I just wondered, is he a swimmer?
Yeah.
Right.
He loves the water.
So what often happens with these dogs, and obviously being a beachside practice, we see this a fair bit.
Right.
It's going for a swim and then the collar's like rubbed and rubbed and rubbed. It's ended up in a skin infection. But if he keeps going in the water, it's not going to get better.
So definitely no water for a week.
No water. Got pills to go home with. You've got some cream to put on.
Yep.
Twice a day.
Yep.
And the less amount of collar time, the better.
He's so well behaved, he doesn't need the collar, so that's good.
So good. I know. We're friends again.
Okay. You ready to go? Okay, there we go. Thank you, Kate.
See ya.
No, thank you so much. There we go.
Kate will be checking up on Dimitri and Bernie in a week to make sure they're both following doctor's orders.
Good boy, Bernie.
On the Gold Coast, it's been a week since Hendrix and his owner Melissa were both badly injured in a vicious dog attack. Still recovering from her own wounds, Melissa has a special reason for coming in to see Alex today.
I did want to say thank you for taking care of him.
It was just a pleasure to be able to look after him. It was a scary time. Must have been a very scary time for you.
Yes, I was so concerned for Hendrix. I saw the dog bite him around the stomach. I didn't know what damage he had had. I knew that if he dies, he's gone. I can't replace him.
Hendrix looks like he's healing really well, but you've still got a battle ahead of you.
Yes, it's quite painful. They wanted to amputate my middle finger on my left hand, and the surgeon decided that I didn't need to lose my finger. He went in to fix the tendons, and I do have to do some physio afterwards.
So if you had the time over again, would you do the same thing?
Yes, yes, I wouldn't change a thing.
Even with everything you've been through with your hands?
Yes. Yeah. If I had to lose my finger, I was like, so be it. Yeah. As long as he was okay.
Yeah. I think you may well have saved his life that night. You're so brave.
Thank you.
Yeah.
I couldn't just stand there and just watch my puppy die.
Come on, you are keen to get out of here, aren't you?
Whenever I'm away from him for too long, I miss him. I love Hendrix. I love him so much. Thank you so much for seeing him again today.
Just, I think, wonderful to meet you, but also to see him, and he's so bouncing with life
He's back
and
to
happiness.
his normal self.
Yeah. Dog attacks are always horrific, particularly when they're on a little 3-month-old puppy. But this story is especially moving because of the bravery of Melissa in going in there and saving her little boy. This is one patient that I'll never forget.
Come on. Come on, Victor. Good boy, Bernie. Come on, guys. Come on.
In Bondi, busy dog nanny Dimitri has been following Dr. Kate's orders, keeping Bernie away from water so a nasty infection on his neck can heal.
Come on, Bernie. Victor. Victor. It's been a week since Bernie saw Kate at Bondi Vet, and he had that skin infection, and he's been back in the pack, but I've been keeping out of the water. It's hard because he loves it so much. Hey, Bernie Boo? We'll wait to see if Kate gives him the all clear today.
Dimitri.
Oh, hi.
Hello.
Hi, Kate. This is the
Hello,
wolf pack.
Bernie. Hello, my love.
I think the injury's almost healed.
Let's have a look at it. Bernie, can you sit down, mate? Such a good dog, aren't you? Bernie's such a good dog. Dimitri, this absolutely looks beautiful. Bernie's skin looks amazing. It's healed a lot better than I expected it to heal in such a short amount of time. All that's left now is to let him get back in that water. Come on, everybody. Come on, Victor.
Come on, Ben. Come on.
Looks like these guys have an absolutely outrageous time. Good to see him back with his bros, really.
No more restrictions for you, buddy.
Good boy.
Oh!
In Melbourne at the Kingston Veterinary Hospital, Jasmine has brought in her 12-year-old Corgi, Kelvin, who's feeling a bit under the weather.
We had a really big party last night and he ate a lot of food, and we woke up this morning to him vomiting everywhere. His stomach's not normally that big at all. So we thought we should bring him here. We were really concerned.
Hello, Kelvin. Hey, Jasmine, come on through.
Thank you.
What have you been up to, mister? Hey? You been up to some mischief?
Dr. Danny Jusek can already tell that Kelvin isn't 100%.
He's looking a little bit sheepish, so I'm interested to see what he's been up to. So tell me what has been happening.
I think he had a bit too much fun at the party last night and he ate a lot of food.
Oh, yes. Kelvin, did you have a bit of a guts, did you, mate?
It's amazing how he sneaks around.
Grabbing a bit here, grabbing a bit there.
That's
hey?
right.
Yeah.
Kel.
You're the master of scavenge.
That's right. Yes.
What sort of foods was he exposed to, do you think?
It could have really been anything. There was like brownies, sausage rolls, pies, lots of sandwiches, and everyone likes to feed Kel.
So just got spoiled.
Yes, that's right.
You've been sucking up to everybody to get little treats all night long, eh? This, unfortunately, is quite a common situation with dogs, and apparently Kelvin, he is known for this. Has he been vomiting or...?
Yeah, this morning he was vomiting a lot.
I think we'll give him a good looking at now, make sure that everything's all right, hey, mate? Just gonna have a little listen to that heart. His heart rate's not up, which is a good sign.
Okay, that's good.
Hey, mate, I'm just gonna
It's okay, Kel.
see how that tummy's feeling. We're very distended there. He certainly seems painful in that tummy.
Yeah.
He's quite uncomfortable with me putting any pressure there, so I'm a bit concerned. So the risk is if your stomach's actually dilated full of gas and then the stomach twists around, that can cut off all the blood supply.
Okay.
So we'll definitely want to get some x-rays.
Okay.
If Kelvin's stomach twisted around, that becomes a life-threatening condition where we need to go into surgery ASAP.
Oh, Kel.
We've got a picture coming through.
Thank you. Okay,
What do we got?
Perfect, thank you.
Hey,
matey.
Oh. He's having some difficulty walking. Oh, settle, settle,
Hey,
settle.
buddy.
Hey.
You're right, mate.
On the Gold Coast, a 9-month-old Mastiff has been rushed into emergency, in serious trouble.
Good boy.
This Bear. Bear's his name.
Hey, Bear.
Doctors Alex Hynes and Gerardo Poli immediately suspect Bear may have been bitten by a deadly paralysis tick.
He's got a nice short coat, so if there's a tick there, we should be able to find it.
A single bite from the tiny insect can cause paralysis and potentially fatal breathing difficulties. In reception, owner Aaron is anxiously waiting with his baby son Bjorn to find out what's wrong with Bear.
As I got home from work, I just noticed Bear's been really lethargic. Asked my partner, she said that he hasn't moved much all day. He's very boisterous, which is the reason why I knew something was up, so I thought it'd be best to bring him in here.
I think I found something back here. This big dog, Bear, doesn't want to walk. We're always worried in a dog that can't walk in this part of the world that they may have tick paralysis. Oh, look at this.
Alex has just discovered a tick isn't the culprit.
Wow. What we found, he's actually got a huge swollen testicle there, so it's not a surprise he doesn't want to walk. He needs some pain relief, and then we've got to work out what we're going to do to help him. This is going to make you feel better, Bear. We don't know how long Bear has been suffering with this. It can be an infection. If left, it could spread into his bloodstream. He could die.
Good boy.
Trishy, come on, let's go.
At Perth Zoo, elephants elderly Trisha and younger Permai are being taken for their morning fitness walk.
Trish, come on, let's go.
Dr. Peter Ritchie is on his way to join them.
I know we're not meant to have favourites, but I definitely have a bit of a soft spot for our elephants, especially for our old girl Trisha. Hey, beautiful Trisha.
Trish, get over. Good.
She is our 61-year-old Asian elephant. So regular health checks are really important for Trisha. She's an old lady with a bit of arthritis, so I like to keep an eye on how she's walking.
Good girl.
So how is she going with her general health at the moment? Is everything going okay?
Yeah, for her age, she's going extremely well.
Yeah.
Trisha has been at the zoo for 56 years, and senior elephant keeper Kirsty has been looking after her for more than a decade.
Good girl, come on.
Some of my earliest memories are of Trisha and coming to the zoo. For a child, it's just amazing to see that such an animal exists in our world. And I remember vividly the day that the news came out that Trisha had got friends, and it was on the front page of the paper, and we were so excited, and we needed to come to the zoo to meet Trisha's friends. Oh, hello. Perth loves Trisha. We all know her, and we all love and care for her. Who's my beautiful girl?
Only around 40,000 Asian elephants are left in the wild, and with illegal poaching and deforestation, their numbers are dwindling.
They are endangered and special ambassadors for their species, so people come here, fall in love, and hopefully want to do something about saving them. Do you still find that you get amazed by things with them?
Every day, hey. Wake up in the morning and pinch myself.
All right, Trisha, time for your medication.
As part of the management plan for her arthritis,
how are you feeling today?
Elderly Trisha needs daily medication, but Trisha isn't a big fan of the taste. And she makes her feelings known.
Oh, that's quite a present.
I know how he feels a bit at the moment with my big belly. I understand, it's not very comfortable.
Back in Melbourne, Danny is worried about 12-year-old Corgi Kelvin's engorged stomach after he sneakily indulged at a family party.
So first things first, mate, let's get an x-ray of your tummy, hey? See what's going on in there.
Danny's concerned that Kelvin's stomach is so full, excess gas could form, causing it to twist. And that could be deadly.
I'm sorry, mate, I know you're happy. Good boy. So this stage, I can't tell why that stomach is distended, whether it is food or if it is gas. Any animal with a dilated stomach that's painful, it's a concern. You good boy. Look at us with our big bellies together, hey? So we've got the x-rays all happening, but unfortunately I can't get involved because I've got a little bub on the way. Just want to keep him nice and safe.
Good boy, good boy.
Vet nurses Hannah and Camilla are performing the x-ray for Danny.
Good boy, good boy. All right, you ready? Oh, Kel. Good boy, good boy. Shh, 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 shh.
Beautiful, how'd we go?
He was a very good boy.
Oh, good work. Thanks so much, guys. Let's have a look. Oh, golly. All right, I think we need to get Jasmine in to have a look at this. Kelvin, what are we going to do with you, mate?
On the Gold Coast, Alex and Gerardo are investigating the cause of 9-month-old Bear's painful enlarged testicle.
That right one is really large and painful.
I think you're the only one here who can relate to this.
I'm sorry, Bear. I'm sorry for
It's
laughing.
all right,
mate.
buddy.
I can appreciate your pain.
There was a few laughs about sore testicles, etc. But I tell you what, Bear wasn't laughing. This is one of the most painful conditions that any animal can have.
Hey, Bear.
It's all
Be
right.
gentle, I promise. When we look in the ultrasound, I'm just going to get a picture.
Gerardo is hoping an ultrasound will provide some clue as to what the problem could be.
There is some fluid around the corner here.
Yeah. We don't know at this stage how serious this is. There's a number of things that can cause this condition. It can be an infection, it can be a twisted testicle that can cause this much pain and swelling. It could be something like cancer. There's really no two ways about it. The best and the quickest treatment for him is going to be castration.
You, Bear, you going to be okay? We'll take care of you, mate.
Enjoy your walk? I did.
In Perth, Peter and elephant keeper Kirsty are doing a regular health check with Trisha, the zoo's famed elderly Asian elephant.
Trish was named after Miss Australia 1963, so she shares her name with another very beautiful lady.
How you going, my beautiful girl?
At 61, Trisha is quite old and she's showing some signs of age-related changes.
Trisha needs daily medication to help with her arthritis, but she isn't too keen on the taste. So Peter and the team have to use some tricks to help the medicine go down.
It's just like kids, you kind of have to mask the medication.
What is she like? A bit of peanut butter?
Yeah, it's a lot easier than getting a tablet in that tastes not so great.
Yeah.
So this is an anti-inflammatory.
It's important that we make sure she's comfortable in her final years and make sure that her quality of life improves every year she's here. So let's go give her her medications and a massage.
Cool.
A massage with a special device is also part of Trisha's daily care.
Trish, come on, let's go.
With her powerful trunk, clever Trisha can already smell the peanut butter.
An elephant's trunk is one of the most sensitive parts of its body, so she's using it to smell and feel everything around her. All right, Trisha, time for your medication. Ready? Here's your first sandwich. Good girl. Yeah, all right, there you go. Last one. Awesome, all done.
The massager has also been helping her arthritis.
She would get stiffness in her wrist, but ever since using this, we haven't seen that at all.
There you go. Standing next to the elephant, it's amazing. And for it to be Trisha, the elephant, who is our elephant, is just even more of a connection for me and just means so much.
It's that little bit of connection that we hook into to hopefully get the next generation to try and save these guys.
Yeah. All right. Well, thank you for that, Kirsty, and thank you, Trisha. See you later.
See you, Pete.
For me, it is truly incredible that I came here as a child and experienced these animals, and now I get to work here alongside them and get to know them. And sometimes you're pinching yourself to wake yourself up and realise it is actual real life.
All right, come with me, have a look at these x-rays.
In Melbourne, Danny is about to show owner Jasmine the cause of Kelvin's massively bloated stomach.
So as you can see, we have a very big stomach.
Yeah.
Normally, the stomach's not going to extend much further beyond these ribs here, so it's very dilated.
Oh, wow. Oh my gosh.
Looking at Kelvin's x-ray, oh my goodness, I don't think he could have fit any more food into his stomach. But good news is that it is just full of food.
Okay,
it's not dilated with gas, and there's no evidence that it's twisted around. So
Okay.
the stomach is sitting in its normal position, so that's really good news for Kelvin.
Yeah. Oh my gosh, his stomach is huge. I knew it was big, but not that big. Feeling his stomach before, I'm very shocked, to say the least. How are we going to get all this food out?
The fact that he's already been vomiting, I don't want to induce more vomiting again.
Okay.
I really want to just let it pass through normally. And we'll obviously need to keep a really close eye on him to make sure that he doesn't deteriorate in any way. We really just need to monitor him closely for the next few hours. Yes, boy. Come on, over here. Just want to make sure that no complications arise from all that food sitting in the stomach. Get comfy.
We're back in a few hours. I hope you feel better, boy. Mwah. Good boy.
That looks really nasty. That must be so painful.
Poor bear.
At the Animal Emergency Service, Alex has just discovered why Bear has been struggling to walk.
All right, just going to pop in here, Aaron, have a bit of a chat.
Fearing a deadly paralysis tick, owner Aaron has been patiently waiting with his baby son for any news.
The good news is we haven't found a tick. What we have found is that he's actually got a really large testicle there, and it's very painful, and he's also got a temperature. Sometimes we find there can be an underlying cause, like he could have had a trauma to the area, and that could have caused an infection if some bacteria got in, but he's going to need to have that testicle removed. Once we do get it out as well, we can see what might be going on in there, okay?
I would prefer him to keep his testicles, but obviously if it's going to mean that he's going to be in pain, then clearly it's the best option to do.
He's feeling a little bit sleepier than he was.
Yeah.
You're right there.
Here he is. There's
Hey,
Dad.
there's your dad.
Hey, buddy.
Hey, he's like Dad.
Aaron is worried, but he knows that 9-month-old Bear is a survivor.
When we got him from the kennel, we had him for a couple of days. We had to take him to emergency because we found out he had parvo.
Parvo is an infectious canine virus that attacks the gastrointestinal system and bone marrow, and if left untreated, can cause death.
Wow, and he survived that.
He survived it, yeah.
Yeah. You're a lucky dog. You're a fighter bear, aren't you? So he's going to stay with us and have surgery. Good boy.
At Perth Zoo, Peter's on the move to see his next patient.
My favourite thing about working here is that I get to ride a bike from patient to patient. I just love this place, and getting on my bike and riding around visiting the animals is just incredible.
This time, Peter is going to need to use special protection equipment.
It's an extremely loud patient, so I'm going to need these. You ready to go?
What?
Despite using protective earphones, Peter and vet nurse Lisa can still hear the piercing call of an endangered juvenile red-tailed black cockatoo nicknamed Rowdy. The noisy patient was hit by a car nearly 2 months ago and suffered a nasty break in her wing.
So this is a bit of a tricky bit. We've got to get the mask over her face to give her the anaesthetic gas without getting bitten.
Peter is hoping to be able to remove a device that's been holding the bird's wing in place while it heals. Anaesthetising Rowdy will be the only way to carry out the procedure safely.
This beak is incredibly big and incredibly strong, and I could easily lose my finger if she accidentally gets a hold of me. I've got the gas on. You can see her little eyes getting sleepy now. You happy she's asleep? Yeah. Yeah. Birds metabolise the anaesthetic drugs very quickly, so now we've got the mask off. I've got to get my tube in quickly or she'll wake up. That's in. If she were to wake up, there's a real risk that she would clamp down on my finger while I'm putting that tube in, or she will clamp down on the tube and actually bite the end off and we could lose it into her airway. All right, so I'm just going to open her beak. Ah, she bit me. Just checking.
Not funny.
Such beautiful birds. One of our most amazing West Australian species right here. And you can see this beautiful girl. She'd had some feathers missing from her injuries when she got hit by the car, but she's starting to regrow them now, which is good. This is her external fixator. This has been in place for about 7 weeks now. It's basically a bit of metal that's going through her bone and coming outside of her body, holding that bone together.
It's this device that Peter is hoping to remove today, but only if the wing has healed enough.
Let's position her for x-rays.
Have you set that to 75 centimetres?
If the wing hasn't healed properly, it could spell the end of Rowdy's chance to return to the wild.
Hello, mate. Hey.
In the Sydney coastal town of Collaroy, Dr. Lewis Hunt has arrived for work to find Butternut, the clinic cat, has been up to mischief.
Butternut, what are you doing in there?
Butternut, troublemaker. Butternut's worst trait is her food stealing. Every day we catch her opening a fresh bag of food, having a few mouthfuls and getting to the point where we've just got to give that bag of food away. She could reopen the same one and that'd be fine, but no, every day it's a new bag.
Ash, look what your Butternut has done. How many bags is that this week?
1.
I would hate to know the number of bags that have been opened that I'm not aware about. I know the nurses keep it very quiet and make those bags disappear without me ever finding out.
We do have something called a butternut discount. So some clients know that she rips into food, so there's a butternut discount if they buy any bags that are ripped.
I'm the only one who realises that you're not as sweet as you look, eh?
Butternut, I think, fell on her feet when she ended up here as a kitten. We were trying to rehome and no one took her and got to the point where she just never left. She's in charge. Butternut is definitely in charge. While Butternut's food stealing is not ideal, she actually does play a purpose here. She's the resident blood donor and she saved about 3 cats I think she's donated blood to over the years and all those cats have made it through. So while we give her a hard time about stealing food, deep down she's fantastic.
Going to come out? Can you walk out? Hey, you're a bit big to try and carry.
On the Gold Coast, it's time for Bear the Mastiff to be anaesthetised for surgery on his painful swollen testicle.
Wow, good boy. Poor Bear.
I can imagine it feeling like a vice. We'll take that vice off your testicles.
Okay, you ready to go to sleep? Good boy. Off to sleep. Okay. There we go. There we go. Good boy.
Alex and Gerardo will be performing the surgery, with vet nurse Tara assisting.
So what we're going to do today is we're actually going to perform a castration on Bear. This is an operation that's done all day, every day in vet practices around the country. But in emergency, this is something we don't actually do very often.
How long since you've done a...
Oh man, it's been a long time since I've had to clip some testicles.
Yeah. We need to get these testicles out because that one testicle is really causing him a problem.
Both testicles will be removed as a precaution in case tests reveal that the problem has spread.
Okay, is he nice and sleepy? So we'll remove the good one first.
So that's the normal one, Alex?
Yeah, that's the normal one. So
pretty big.
I know, isn't it? One testicle out.
Goodbye, friend.
Goodbye.
Now it's time to tackle Bear's larger abnormal testicle.
It's so swollen and so adhered because of all the inflammation that it doesn't want to move, which means it's really hard to cut it out. I think what I'm going to need you to do is push it up. That is stuck there. We're going to really have to put some pressure on there. This tissue is so firm and thickened. Nothing here is normal.
Look at that fluid that's coming out of there.
No, it doesn't look healthy at all.
The vast amount of fluid could be due to infection and maybe sepsis, where the body reacts to a potential infection by shutting down organs.
The diseased testicle looks really bad. When you have tissue like that in the body, they can become septic really quickly and it becomes life-threatening in that situation.
He can die.
At Perth Zoo, Peter and his team are about to take an X-ray of Rowdy, the red-tailed cockatoo's wing. They're hoping that the break, which happened when Rowdy was hit by a car, has healed.
So I'm just assessing this bird's range of motion in her wing. This is her fractured wing over here, and you can see this wing is a lot tighter. All the ligaments and tendons have contracted down in response to this fracture and the healing. She's going to need time for this to heal and to re-stretch and reuse these muscles normally, and that's where the rehab process comes in, where she's going to learn how to use this wing again.
Just feel it, make sure our bones are in the right place. Yep, okay.
The X-rays show that Rowdy's wing is healing well, so Peter can start by removing the stitches.
Just these couple here.
Yeah.
Next, he needs to unscrew the external fixator that's been bracing the wing.
Essentially what she has in her wing is a series of pins and connectors, and the fracture is about here, and they're stabilising the bone either side. Once I remove this support beam, her fracture's no longer going to be stabilised, and I've just got to be careful that it is healed properly, because if it's not, we could re-fracture her wing. Now we just want to have a good feel of it. It feels really good. The fracture feels like it's healed properly and there's no movement in it. It's great.
Peter's confident he can now remove the remaining pins.
So I've just got my chuck here to help me unscrew them.
The pins have to be gently removed, with Peter aware that the delicate wing could easily re-fracture.
There we go. All right, so this last one here that's bending up is going all the way through the bone at the moment, so right through the middle of that bone, and it's going to be a little bit more difficult to wiggle all the way out, so I've just got to be careful with this one. There it is. So you can see it was all the way inside that broken bone. One side of the broken fracture here, another side of the fracture here, and this would have been holding those two sides together.
It's time for the cockatoo to wake up.
I'm going to turn him off. So birds do tend to wake up a lot quicker than other animals.
Lisa must maintain a firm grip in case Rowdy strikes out with her powerful beak when she returns to consciousness.
Come on, sweetie. Time to wake up and feel your new wing. Oh, there's the eye. You gonna have a chew? There we go.
The last step for Peter and Lisa is to get Rowdy back in her pack without incident.
Don't let go now. Watch out, yep. She's awake. She's back in her pet pack and ready to go back to the rehab centre.
Removing the brace is a milestone, but this young cockatoo still has months of recovery ahead. It could be a year before her wing is fully healed and she can be released back into the wild.
Nothing here is normal.
At the Animal Emergency Service, Alex and Gerardo have successfully removed Bear's healthy testicle, but the infected one is still stuck firmly in place. It must be removed or Bear could die from infection.
I'm actually going to try and break down some of these adhesions with my fingers. Sometimes using your fingers can be the best way because you get behind the testicle and really try to break down those fibrous bands. All right, try that.
Okay.
That's it. That's it. There it is. Wow. Look at that. There is nothing healthy about that testicle.
The testicle is clearly infected.
Look at that discoloration there. That is actually already starting to die off.
Yeah.
So that would have made him really sick very, very quickly. He was
just a true emergency.
very lucky we got in there.
There we go. Okay.
It's the other one there.
Put them for comparison, yeah.
So yeah, look at the size difference between those two and the colour difference. If this had gone on for too much longer, it would have actually made him septic. So the infection could have actually spread through his body. He could have died. So he's a lucky dog.
I think I can say for every male out there, as much as you want them, I'm fairly certain he doesn't want that one.
Yeah.
He's going to feel a lot better.
Nothing about this was a normal castration. I really could see how lucky it was that Aaron had brought Bear down to us.
But Bear isn't out of the woods just yet. The diseased tissue will be sent to pathology to be tested for cancer. And it will be a few hours before Alex will see if this brave young dog's paralysis has improved.
Hey, Mr. Bear.
It's okay. You're okay.
At the Coleroy Plateau Veterinary Clinic, Kylie and her son Max have brought in their 18-month-old dog Mystery. Sensing a canine intruder, clinic cat Butternut is beating a hasty retreat.
Can you open the door for Mum, please? Thank you. Mystery was outside in the yard and she screamed, jumped, and then I saw what I thought was a snake fly.
The shy rescue dog has had a nasty encounter with an Australian water dragon.
There wasn't any blood or anything, so we just sort of kept an eye on it, and she was fine last night, and then today... She started limping, because I was going to take them for a walk, wasn't I?
Hi, Kylie. How are
Hi.
you?
Good, thank you.
Hello, Mystery. I hear Mystery's been taking on water dragons.
She has.
Oh, sweetheart, that's no good. Water dragons are native to the east coast of Australia, and they're a lizard that can grow up to about 1 metre long. Normally the water dragon would have taken off, but he's obviously gone toe-to-toe with Mystery, and Mystery's come off worse for wear. All right, so yeah, obviously sawing that foot there,
Yep.
so we'll go through and have a little look at her. Hey?
Sounds good.
I don't think I've ever seen a dog bitten by a water dragon. I've seen dogs bitten by snakes and spiders and that sort of thing. So this is a first. So this is Mystery's attacker. This is a water dragon, a fairly impressive looking lizard. These guys have got really sharp spines, really sharp claws, sort of used for climbing trees and that sort of thing. And unfortunately for Mystery, they've got really sharp teeth as well. Come on, Mystery, you got to come and say hello, sweetheart.
Come on. Are water dragons poisonous?
No, luckily water dragons aren't poisonous, but they've got a mouthful of bacteria, so when they do bite, the wound can then get infected. I'm not surprised Mystery is sore in that leg, so we'll have a good look at those feet.
She's not very good at letting us touch her feet, so good luck.
A lot of dogs, but particularly rescue dogs, hate having their feet examined. And I think it quite often comes from the fact that their nails are being cut too short as a puppy, and that really hurts, and therefore they hate anyone going near their feet.
You're okay. You're okay.
Really?
You're okay. You're okay. You're okay.
Poor old Mystery really doesn't want me to have a look at her foot. It's a bit of a balancing act, trying to get a good look without being bitten myself.
You're okay. You're okay. You're okay. You're okay. You're okay. You're okay. Here.
It's getting to that point. If I can't get a look, we may end up having to sedate her. I'd like to avoid that if I could.
You're okay. Good girl.
In Melbourne, greedy Calvin has spent most of the day under observation. And Danny is satisfied he's now out of danger, after his party food indulgence.
Yeah, we're still quite full. It's going to take a few days for all that to pass through, I think. Hey, bit of digestion. Be on a bit of a diet for a bit, I think. Come on, mate. Where's Mum? Where's Mum? There she is. I'm happy that Calvin is all good to go home. He's been nice and stable, hasn't had any more vomiting. The biggest challenge for Jasmine and the whole family is going to be not feeding Kelvin. I think he just gives them those puppy eyes, and how can you say no? So I think for tonight, no dinner.
Okay.
How are you going to go with that?
I'll try. We'll see how it goes.
He's going to try and get it out of you, I know. I think he's got plenty of food in there to last him a bit. If he's doing well, you can start to introduce food, but just small amounts.
Thank you so much.
It's okay. You take it easy, guys. Alrighty. Home time, Kel.
Let's go, Kel.
Come on. See you later.
You're okay, good girl.
Back in Coleroy, Lewis is struggling to get a closer look at the nasty bite on Mystery's foot from an Australian water dragon.
You're okay, good girl.
It's getting to that point. If I can't get a look, we may end up having to sedate her. I'd like to avoid that if I could.
You're okay, good girl. Good girl. You're okay.
When I finally get a look at Mystery's foot, that toe of hers is a little bit swollen and super sore to touch. Oh, sweetheart, hey?
That was hard work, wasn't it?
Really tough. I think I'd be inclined to treat her with some antibiotics at this stage. If we don't treat Mystery's bite, there's a real possibility that wound will get infected and really painful for her to walk on. You can see that one there is actually a little bit swollen.
Oh, it's
and
okay.
very sore there,
And there's
aren't you,
Max,
hey?
she wants a cuddle from you.
Yeah, Maxie will look after you. You guys are best buddies, aren't you, hey? Oh, you good girl? So we're going to start Mystery on some antibiotics and give her an injection for pain relief as well, because she's obviously sore. Come on. There you go. Done.
Mystery needs a second jab, but now she's extra wary.
Come on, Mystery. It's all right, sweetie, hey?
And come here, Mystery. Let me hold your head for you.
Come on. There we go.
Come here. You're okay. You're okay. Good. Good girl. You're okay.
Mystery, did that sting, hey? Oh, come on.
Oh, did he really hurt you? Oh, come here. Oh, it's okay.
I thought Mystery was going to be much braver. She really carried on after I gave her that needle. I think she thought I'd stabbed her rather than just gave her a little injection. Oh, sweetheart, that wasn't that bad. You're a big sookie lala, aren't you, hey?
It's okay.
Yeah, I'm right. Oh, yeah, it can't have been that bad. I'm happy to take your treats.
And turn my bottom to you.
The fact she took a treat right out of my hand immediately after the injection shows it didn't really hurt that much and she was just carrying on.
Well, tail's wagging again.
Yeah, bribery at its best.
Yeah.
Are you smart enough to hold a grudge, hey? There you go, you're going to forgive me. It's really important that Mystery and I leave on good terms, because if she leaves after I've looked at her feet, given her lots of needles, she won't want to come back here. But if we can try and sort of just resurrect that bond with a few treats and cuddles, hopefully she won't have such bad memories and hopefully she'll come back and see me again. Oh, Maxie will look after you, won't he, hey?
Yeah.
Yeah?
Yeah, Mr. I'll look after you.
Yeah.
Yeah. Thank you very much.
Yeah, all done.
Say bye.
All right, Carly.
See ya.
See you
Hopefully
later.
you won't see us back.
Yeah, hopefully not too soon. Now, I'd be surprised if we have to see Mystery again. Obviously, if she doesn't respond to the treatment, we will. But she'll be feeling a lot better by tomorrow morning. All right, see you, Mystery.
Thank you. Bye.
The next morning on the Gold Coast, Aaron is back to pick up Bear. It's only been one night, but the family has missed him.
They're all going to be very excited to see him. So I'm sure he's going to be excited to see them. So it should be good. So get him home.
Bear! Hello, matey. Look at you. Good boy. Come on. Hey?
Alex is also excited to see her patient.
Bear is looking so much better this morning. Oh, look at you. You're walking. Hey? Good boy. You have been through so much. Oh, look, I got a big kiss. Oh, good boy. Good boy. He is still a little bit swollen back there. That swelling will go down in the next couple of days and you won't even be able to tell. I think there's someone here who's going to be very happy to see you. Come on. He's walking a little bit bow-legged and that's not surprising. That wasn't just any normal castration. That was a big surgery that he underwent. Bear still needs to rest. He's been actually quite sick, so the most important thing is just that he's given time to recover. I still look at him this morning and think, wow, Bear, you are one lucky dog.
Look who's that.
Hello, buddy. Hey. Hey. Johnson.
Yeah. My favourite moment is when I bring that patient out and they see their owner again. It's a beautiful time. It was actually an infection.
Glad I brought him down when I did then.
Yeah, time really was a key factor.
Yeah.
Yeah, lucky boy.
Ready to go home, buddy? Thank you for everything.
We don't want to see him anytime soon, if possible.
No.
Poor Bear. This boy is only 9 months of age and he's already survived parvo and now an infected testicle that's almost taken him out. I love this dog, but I'm really hoping that Aaron doesn't have to bring him back to the emergency hospital ever again.
Hey, you stay out of trouble.
But Alex won't be able to fully relax until she's got Bear's test results back from pathology.
Thanks again.
See you, mate.
In Melbourne, Danny has almost finished for the day, but has one last patient at a local wildlife shelter.
Hi, come in,
Michelle,
Danny.
how are you?
Good, thanks. Come in.
That's good. Got a patient for me, I
yes,
hear.
I have.
Michelle runs one of the largest animal rescue shelters in suburban Melbourne.
I have 60 different animals at the moment. Possums, lorikeets, galahs, cockatoo, a shingleback.
Michelle's latest arrival is an injured magpie.
Where's this little Maggie hide? Gonna come out here, we'll bring him. Oh, sweetheart, okay. I absolutely love magpies. They do get a bit of a bad rap, but they can be such lovely little characters, so I hope people learn to love them a bit more. So what's happened to this little guy?
It's been attacked by a raven. It's got an ulcer in its eye and it's got a puncture in its head.
Oh, sweetheart, you poor little thing. Carers like Michelle are just, they blow my mind. The commitment that they put into what they do is just phenomenal. Her whole life revolves around these animals and, you know, without her help, they wouldn't end up back in the wild. All right. Here, mate. That's all right. Here. Oh, darling. It's all right. There. Yeah, sweet pea. So that eye there, it's all caked over at the moment. I need to get a bit of saline to clean up that eye a bit to see what it looks like underneath. I'll hand him back to you so we can have a little look at that eye. So the discharge is basically from infection and inflammation.
Right.
There's just lots of white blood cells and inflammatory fluids. After clearing away the discharge, I can see that those eyelids are quite swollen. He's also not wanting to open and shut his eyelids by himself, so whether that's just from all that swelling or whether there's some neurological damage, only time will tell. All right, so we'll just see if we can stain up that cornea to have a look for any ulcer. We use a dye called fluorescein to show up any defects in the cornea. Just gonna have a little look and some magnification. Very groovy looking magnification. So we'll just have a little look to see if there's any ulcers there. Okay, so there certainly is an ulcer there. So I think the best thing at this stage for this little Maggie is going to be lots of TLC, some antibiotic eye ointment, and ideally a bit of pain relief and anti-inflammatory to help with the swelling around the eye as well. And then we'll just have to keep a really close eye on the eye. We'll have a little look at this laceration that was on the top of the head too. Oh, well, that's healing up really nicely, so I'm not too concerned about that. There's no sort of signs of infection going on there. Doesn't look very inflamed anymore. So what have you been doing? Perfect. Good job. All right, so it's just that eye, and hopefully we can get that back under control and we can get him back home again.
Terrific.
Yeah. Hey.
Thank you so much for that.
Oh, it's such a pleasure. Such a good little patient, though, hey? You have.
Before Danny leaves, Michelle has a surprise.
Who's in here? Come on, Bubba.
I wasn't expecting this.
On the Gold Coast, Alex has received the results from the biopsy after Mastiff Bear's emergency castration.
We sent away the testicle to the lab, and the good news is it came back as a simple bacterial infection.
Okay,
What do we got?
perfect, thank you.
This Bear. Bear's his name.
He's having some difficulty walking.
If we hadn't removed that testicle, it could have led to sepsis. That's an overwhelming infection that starts to spread to other parts of his body. It can be deadly. Look at the size difference between those two and the colour difference.
He's going to feel a lot better.
We don't exactly know how Bear got this infection, but the great thing is castration and a course of antibiotics, and he's well on the road to recovery.
Oh, Michelle, what a treat. I wasn't expecting this.
I thought you'd like to see them.
Oh,
They're so beautiful.
yeah. They're just gorgeous.
They were due for a feed, so
Why
gives
not?
me a break.
Oh.
Back in Melbourne, Danny's delighted to be able to help wildlife carer Michelle with two very precious babies.
Got a little ringtail possum here. Oh, darling. Are you going to have a feed? How often are you feeding these guys at the moment?
Every 4 hours
Yep.
through the night.
Yeah, great.
Hopefully within a week or two they should be old enough to start drinking themselves, where I can just leave the milk and the branches in there, but
Yeah,
at this
yeah.
stage they still need mum's milk.
Here in Michelle's property, it's like a little sanctuary for all these animals. She's just doing such a remarkable job. It's just mind-blowing. It must be impossible not to get attached when they're so cute.
Oh, it's very hard. They're just so cuddly.
It feels amazing being a vet and actually being able to make a difference with wild animals, to be able to actually step in and get them back out to where they belong. It feels really good.
At Dr. Kate Adams' clinic in Bondi, Sophie has arrived with her much-loved pet rabbit.
So today I brought in Poncho, 3-year-old mini lob. My partner bought him for me for my birthday. It was very surprising when he rocked up with a rabbit, and I thought, what do I do with this? I've never had one before. They're actually super cuddly.
But Poncho isn't his usual self.
He hasn't been eating, so a little bit concerned today. You're all right, Bunny.
Hey, Soph.
Hey, how you doing?
Come on through. Poncho is so cute. I can so see the appeal of having a pet rabbit. They're absolutely gorgeous pets. The Ponch Man.
Yep.
What's wrong with him?
He hasn't been eating for about a day and a half.
Okay. Hey, little buddy. A rabbit that's not eating is a really serious situation. Rabbits can go into gut stasis where the gut doesn't move very well, and they can die from that. He means quite a lot to you.
Oh, yeah.
He's pretty attached.
Yeah, I'm very attached to him too. I don't know what we'd do without him.
So we need to obviously get him eating again as a priority. I know, sweetheart. But we do need to have a look for any underlying causes. You worry your mum, don't you? Can't see any ulcers there. Eyes are looking beautiful. He hasn't had any ocular discharge. Have you tried to massage his tummy at all?
No, not yet.
I know, Bubsy. It's okay. Poncho's a really sweet patient. He is so amenable to being examined. He lets me do anything that I need to do. But the fact that Poncho is so placid today is actually quite concerning. It could be actually that he feels really rubbish. I can feel in his tummy things are not good. It's hard at the top of the tummy there. Whatever it is that's going on is very concerning for me. 36.7. His temperature's a bit low, Soph.
Okay.
I can see that Sophie is really, really worried.
You're okay.
Let's get him some pain relief.
Yeah.
Whether or not we're dealing with gut stasis or an obstruction here, the reality is this guy would be feeling pretty darn sick right now. He needs to start eating and he needs to start pooing. What I'd like to do with him as a start is we're going to try and give him some things to actually get the gut moving.
Yeah.
The second part of this is that I think it's probably worthwhile taking some x-rays.
I'm a little bit concerned, but hopefully it'll all get sorted and he'll start eating again.
Okay, little bud, you're going to stay with me. I'm a very sick rabbit. Oh, he's so sweet.
Thank you.
Poor Sophie. I can see that she's trying to be really brave.
Right, matey. Be good.
You'll see him soon.
Yep.
I'm trying to be brave too, but I'm not hopeful. Okay, little mate.
We should do a consult in Bondi so that we can go to the beach.
In Sydney, twins Alison and Audrey Shen are on the road in their mobile vet clinic, heading to see a very special patient.
Sophia, the little sausage dog. She's a mini, tiny dachshund who's had a bit of a tough time. She actually had spinal surgery. Mum and Dad love her. They absolutely dote on her. She's like the baby.
How could you not?
You're going to want to steal her.
You distract the owner and I'll grab her and run.
Steal her. I'll put her in my handbag.
Okay, we're here.
So dashies, they're prone to back issues because their backs are so long, and that the dynamics of it when they're running or going up and down stairs, they twist in the middle, and that makes them prone to slipping a disc or doing some back injury.
Hello, how are you guys? Look who it is, Sophie. Good girl.
Hello.
Okay, come through, guys.
As part of her recovery from spinal surgery, mini dachshund Sophia has been having regular acupuncture.
You say hello, Sophie.
So how's she been?
Yeah, she's doing really, really well, I think. She's up and about and walking, which is fantastic, because we weren't sure if that was going to happen. We were out one night and we came home and unfortunately she was paralysed, the back legs, so we took her straight to the vet and, yeah, they operated on her straight away, which was probably the best thing we did.
A combination of Western and traditional Chinese medicine is helping Sophia's recovery.
Acupuncture, is it mumbo jumbo?
Well, we know that it works on humans, so having it on animals is just the next step, really.
I think we're quite smart with using it. It's not just acupuncture to cure a condition. It's always an adjunct to conventional therapy.
Okay, so I'm just going to do a couple of points up here in the shoulder. It's a very good point for bone, so it helps with, you know, any orthopedic surgeries, arthritis. I've got the treats. Should we give that to Auntie Audrey?
Shall I be
Your
the
motivation in life.
Favourite. Yummy.
Yummy.
With the laser and the electroacupuncture, it's a lot easier to do rather than a needle. With the needles, they do have to stay in for a bit longer. With Sophia, she tolerates the laser and the electroacupuncture really well, so that's her preference. So she'll just be feeling a little bit of a tingle, a bit like pins and needles.
I think she likes the heat.
So with acupuncture, it's a little bit different from Western medicine in the sense that we don't treat the symptom to make it go away. We sort of balance the body with energy and blood flow, and in that sense, the body will heal itself. So that's the basis of traditional Chinese medicine. So we're coming down to the injury point as well as the point that she's had her surgery. You'd be surprised, the animals that do have physiotherapy and acupuncture after the surgery, their recovery is a lot quicker than those that don't.
Yeah. So what does that feel like?
So I can do a little point on you.
Do it, okay.
So it's just a little bit warm and there'll be a little bit of a pins and needles.
Okay.
Put your hand like that.
Yeah. Okay. Can't really feel anything at all. A tiny bit of heat.
Yeah.
But that's about it.
Good girl. You're doing this well.
Because of her injury and the dynamics of her back, you know, this is always going to be a weak area. It's at that pivot point of the spine.
Yeah.
So having regular acupuncture and physio to build up that strength and also for arthritis in the future.
It's so beautiful having the girls come to your house and they take such an interest in Sophia. They absolutely love her. Despite being very professional, I feel like they're my friends that are coming into my house and caring for my dog. They love her as much as I love her. About one more treat.
One more treat, Auntie.
Yes, Auntie Audrey's in charge of that one.
I think I brought a special one. Did I bring a
You haven't had
special
dinner?
one? Is that a big special?
Oh, tasty. Oh, thank you.
No worries. It's a pleasure to meet her today.
You've been good today,
She's
Soph.
such a good girl.
Today, Dr. Peter Ritchie is heading to a part of the Perth Zoo that most visitors never get to see.
I'm on my way to see a furry little critter. I've got to be very careful because she's critically endangered and she does have very sharp teeth.
Come on in, Pete.
Thank you.
Peter is meeting primate keeper Jenna and a very special little girl.
I'm here to see Livia for her health check.
Yeah.
So tell me how's she been going?
She's been going really well.
Livia is a cotton-top tamarin. She's one of our 2 females. She's housed off display, meaning the public can't see her.
Come on.
There's a massive operation here behind the zoo that no one gets to see when they come to visit.
It's going to be a big day for the little monkey. Plans are underway for her and her sister to eventually be moved to a public display area. The first step is a full health check under general anaesthetic for lively 7-year-old Livia.
The procedure today is to ensure that Livia is in good health and is able to go into her new exhibit. We want to make sure she's able to get around and do all her normal primate things while she's in there.
Yeah, to check she's all good for their big move.
All right, Jenna, I'll leave you to it to get them ready to transport up to the hospital.
Sounds good.
We really want to get her move on now. She is a tiny little animal and it's important we get the whole procedure done rather quickly. So I want to get things happening so we can get her back into her exhibit as soon as we can.
Bacon. Love bacon. Hey?
On the Gold Coast at the home of Dr. Alex Hynes and Dr. Gerardo Poli, partially blind and deaf Border Collie Diesel is facing a new health battle.
You can see when he stands, his head's tilted to the side.
Yeah.
Like as if the world is on an angle.
Good boy, Diesel. It's almost like when he starts to get really dizzy, he just wants to lay on the floor, doesn't he?
Yeah. Oh, you can see his eyes. His eyes are flicking bad now.
Yeah, I can see that now.
I've had Diesel for 13 years. I bought him as a companion for my first dog, Sheik, who I've had for 14 years until about 2 months ago. Diesel does miss Sheik. When Sheik passed, he became a lot sadder and a lot quieter. You know, I miss Sheik as well, and she was my first dog. And when I was in second year, I realised I didn't really understand the bond between humans and pets. And I bought Sheik as a way of actually understanding this bond. And I bought Diesel because Sheik needed a friend. Sheik and Diesel were my children, essentially.
But Diesel is suffering from more than heartache over Sheik's passing.
Diesel's showing neurological signs, which we call vestibular disease. They lose balance. And their eyes start flicking, they become nauseous. And Sheik developed that about 2 months ago, and she deteriorated rapidly and started seizing. And over just the last week, Diesel's actually been having multiple episodes of vestibular disease as well. Oh. As a veterinarian, I know that old dogs can get this, and sometimes it can go away and be okay. But he's had numerous episodes, and my big concern is that he has a brain tumour or something like that. Hey, poor matey.
It's really difficult for me to see Gerardo go through this. Generally, he's the strong one and he's there as my support. And now the tables are really turned and I need to be there for him. I hate seeing him in pain and know that I can be there for him, but I can't take that pain away. I think really you've got to find out what's going on, and the only way you're really going to do that is via the MRI.
Yeah, you're right. An MRI will give us more information.
I think that's what we've got to do.
I appreciate you being here, thanks.
Thank you.
Oh. I am clinging on to some hope that it is just inflammation that will pass. There's a possibility that he might just have a geriatric vestibular disease. If that's the case, it means that he just needs time.
Come for a ride, Diesel.
So today, I'm going to take Diesel into the hospital. Oh yeah, here we go. Good boy, mate. Good boy, good boy. And have an MRI to have a look at his brain and see if there is a structural change or if there is a mass there. Just a short little trip and we'll find out what's going on.
Good boy, Diesel.
We've got little Olivia in here.
At the Perth Zoo, Peter is ready for his special patient, 7-year-old cotton-top tamarin monkey, Livia.
The procedure today is a general health check to ensure that Livia is in good health and is able to go into her new exhibit.
Livia has been housed in a behind-the-scenes section of the zoo. If this health check goes well, she'll be ready to make her public debut.
We want to make sure she's able to get around and do all her normal primate things, and it's a really good opportunity while we're moving her to have her in our hands and have a closer look at her.
The team is wary of Livia's razor-sharp teeth, so she's being held in a bag for everyone's protection.
Just going to pop her head into the mask through the bag.
Peter's first step is to sedate the tiny primate.
Livia's not too happy to see me today, and she is making a bit of a noise about it. Yeah, she is just lightening down a little bit now. I can feel she's relaxing.
So just loosen the bag up so we can see what her response is like.
She's not really reacting now, so let's see what she's doing in there.
Put my hand in.
All right, here she is. All right, back under the mask. She's having nice breaths at the moment, which is good. And I can feel that she's got a nice, strong heartbeat. She's relaxed down quite nicely at the moment. Give her a few more moments to breathe in the anaesthetic and make sure she's at a nice level of anaesthesia, and then we'll get ready to do our procedures. Because these guys are such a tiny little critter and they have such a fast metabolism, they hold a very high risk under anaesthetic. They tend to lose their temperature quite quickly and their glucose levels will drop very quickly, so it's important we get this done rather fast.
Cotton-top tamarin monkeys are highly endangered, so it's crucial Livia is examined thoroughly to ensure she remains healthy.
What I'm going to do now is have a look at her from head to tail. It's rare that we get the opportunity to get so close to our animals and ensure that everything is in good working order. And so I want to make sure I don't miss anything. I'm going to start by just having a look at her eyes. So I'm trying to have a little bit of a look into the back of her eye. It is a bit difficult because she is so small. So there's a little bit of an opacity in one of her lenses. It may just be the first signs of her starting to get cataracts forming in her eyes. And that's a normal age-related thing for many different animals, but at the moment it shouldn't be too bad. Just like us, dental disease is common and sometimes they get some bad gingivitis, but her teeth aren't looking too bad. A little while ago she fractured the very end of this tooth here and healed very, very nicely. Doesn't seem to be any issues. And then we'll continue our physical exam. I'm just going to continue down and keep looking at everything on this side. The little toenails all look fine and her palms all look fine. Arthritis can be a bit of an issue as they get older as well. They rely so much on their arms and their legs to get through the trees and manoeuvre through the enclosure. So it's important that they're able to do that. Everything's feeling quite good.
Pete, we're just at half an hour of anaesthetic time, so we probably just need to step up the pace a bit because we need to get her awake.
No worries, let's get moving. The clock is ticking, and we know from previous procedures that we don't want to keep going too much longer than this.
Hey, little mate. Let's try and get you better. You're a sweet little rabbit. Sweet big rabbit.
At the Bondi Clinic, Kate needs to urgently try to find out why Poncho is so sick.
You okay? No, buddy.
The little rabbit's bowel movements have stopped and he's not eating.
This guy would be feeling pretty darn sick right now. Whatever is going on here would be quite painful and the poor little guy needs some pain relief. There you go, sweetheart. Now, this is a little bit of antacids. No, buddy. Down the hatch. Swallow. Swallow. There we go.
With vet nurse Katie assisting, Kate is now going to do a blood test in the hope it will give some clues as to why Poncho's health is deteriorating.
I'm just going to give you a little bit of a haircut, Poncho. A little bit of a haircut. This is one of the really tough parts of the job. Rabbit veins are so little, it is so difficult to get a blood sample. Just going to have to find exactly where that is. Okay, there's a good vein right there. I don't know why this is not going in. Hang on, wait, hold.
This is the tricky part.
Sorry, that, mate. Gosh, that's little. Okay, ready? Let's give it a crack. Ooh, that's bad. We've got some serious issues. Oh my goodness. I have never seen a blood glucose this high in a rabbit before. It is off the chart. Poncho, you're not well, mate, are you? You're not a well little rabbit. Okay, sweetheart. I know.
A high glucose level could be a sign of an abdominal obstruction. And for little Poncho, that could be fatal. The next step is an X-ray.
That's going to allow us to have a look at the intestines, the stomach, see how much gas is in there, and we're also going to be able to look for an obstruction there. I'm very, very worried about this little guy. It's super critical for him.
Does it feel a bit weird to bring your own dog in?
Yeah, it does actually. Oh, it's all right, Diesel.
All right, don't panic,
it's okay,
mate.
It's okay.
He really doesn't like being carried, eh?
No, he doesn't like me.
At the Animal Emergency Service on the Gold Coast, Alex and Gerardo have just arrived. Not for work this time, but with their own beloved dog, Diesel.
Good boy.
Good boy. Slowly, we'll get there. Yeah.
The 13-year-old Border Collie has been showing distressing neurological symptoms, and Gerardo is hoping an MRI will provide some answers.
If there's nothing there, then it would give me a sense of relief knowing that we could probably persist a bit longer with medical management, and hopefully a bit more time, he'll get better. Almost there, mate. But I suppose I'm guarding myself and preparing myself for the worst. This could possibly be his last day. We'll find out what's going on in there, Hank, today. You don't like being in hospital, do you, mate?
He's a bit overwhelmed, I think, isn't he?
Yeah, he's a bit overwhelmed. I think the combination of him being in hospital here and also receiving unlimited pats from me today is making him feel a bit more stressed.
Yes, good boy.
Hey, bud.
Hi, how are you?
Dr. Peter Barron is the internal medicine specialist who'll be performing the MRI.
How you going, buddy?
Having a bit of a tough day today.
Oh, for sure. So, look, I think a brain MRI is going to be our best way of diagnosing his balance problems.
Yeah, his episodes, they're very frequent, and he gets better and then he gets worse and he gets better and he gets worse, and my biggest concern is that he's got like a tumour or something in there.
Look, it is a possibility in somebody of this age. You know, we're still hoping that he might have that old age vestibular syndrome where their balance centre just goes a little bit kooky for a while and then sort of comes back online, but fingers crossed, and hope we find good news for you with the MRI.
Yeah.
We'll take him through now and give him his pre-med and go from there.
Good boy, Hank.
Come on, buddy. Come on through. Gerardo hit the nail on the head when he said, I'm concerned because this has been multiple events over several days. And I think certainly with the geriatric syndrome, so this is where the balance centre sort of goes offline in older animals. You're a good boy, aren't you? It's idiopathic, which is just a fancy way of us saying we don't know why it happens as a veterinary community. And a lot of those cases will resolve. Here we go. They can have recurrent episodes. This many, this close within a certain period of time has me concerned. And that's why we're doing the MRI.
I can't hear any gut sounds.
At Bondi, Kate and vet nurse Katie are about to x-ray Poncho to try to find out why he's stopped eating.
Despite the rabbit's size, they have a really complex digestive system. It means heaps of things can go wrong. That's good. I really don't want to put him under the stress of a general anaesthetic, so I'm going to try and take these x-rays conscious, right? Without a moving gut, anaesthetics and sedations, it's not ideal. X-ray. Okay, mate. Oh my goodness. This is not very good at all. So what I can actually see here is I can see a really large stomach. It's got gas in it, a lot of gas. You can see some gas in the small intestine here. But fundamentally what we can see here is pretty much nothing. There is absolutely no food. No wonder Poncho feels so bad. The top half of his stomach is completely crammed with food. There is a massive obstruction there. Nothing can get through. This is really, really bad news for Poncho. We have to do something about this pretty quickly. My heart is just sinking. Sophie is on her way back in with her partner. I have nothing good to tell them at this point.
Hey, Bob. Hey, look at you.
So we've got two options, right? So the first option being that we manage him medically.
Yeah.
Right? And we try and actually get whatever's stuck there, and it's probably like food impacted, right? Try and get it to move.
Yeah.
The second way that we do this is that we go surgical. We open him up and we actually try and get what's there to actually move down.
Yep.
Sophie and Dusty are devastated, just devastated. We're caught in the middle of a rock and a hard place with this one. If we do medical treatment, it may or may not work. Surgical treatment, Poncho's not a great anaesthetic candidate. It's hard to know which way to go on this one.
Do you think we should medically give him a few hours? Yeah.
Yeah. Yep, let's give it a crack. With the understanding that he might die in the meantime.
Come on, you can do it, buddy. You can do it. I know you can.
Poncho's medical management will start with a drip overnight to help his little body rehydrate. But first, for Sophie and her partner Dusty, it's time for a heartbreaking goodbye.
Fight, 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 okay?
I'm the eternal optimist. I always think that I'll go to the very end to try and save a patient. I really hope that Poncho gets through this. He's a tough little battler, and if I can just get him through the next 24 hours, he's got a fighting chance.
Oh, what a brave lad. A bit loud, mate, I'm sorry.
At the Animal Emergency Service on the Gold Coast, Nurse Michelle and vet intern Mel are preparing to anaesthetise Gerardo's 13-year-old Border Collie Diesel for an MRI.
Oh, your naked little arm. Yeah, my beautiful boy, you were so brave.
Good boy, Diesel.
Internal medicine specialist Dr. Peter Barron wants to find out what's causing Diesel's alarming balance issues.
Diesel's anaesthetic's going quite well, especially for an older boy. We're obviously very, very cautious with every anaesthetic, but I think when they're older, we're, on point with everything. So we'll proceed from here and see what we find.
Anaesthetic off, oxygen off.
1, 2, 3, you're right now.
With Diesel fully anaesthetised, Peter and his team can move him over to the MRI room for imaging.
Okay. Oxygen is on.
ISO's on 2%.
He's connected.
Across in their office, Alex is staying optimistic that Diesel will be okay.
Do you know how much longer it's going to take?
At least another hour or so. But when you're waiting, it seems a lot longer.
Yeah, it does.
I think G has already convinced himself that it's going to be bad news, almost because he needs to prepare for the worst. But I'm not so sure. I really think that there's a very good chance that the MRI could be clean.
Very happy with the positioning. Let's move out.
And Diesel may just need more time.
So basically what we've done is what they call a scout. So the machine does a quick survey of the brain in 3 different views. And so that way we can basically look at the brain in 3 dimensions. And those different settings, show us the anatomy of the brain, can show us inflammation, can show us clots within the brain like a stroke, aneurysms, burst blood vessels, those sorts of things. And of course the thing that we're hoping we don't find it, which is a tumour. Diesel's out of the MRI now, and at this stage we're just going to wake him up out of his anaesthetic.
It's been a big morning. Poor sweet lad.
Peter knows that Gerardo is desperate to hear the results.
When you're dealing with someone's pet that you actually work with, it's very, very difficult having a chat with them about findings, especially if they're negative findings.
All right, shall we flip her over and have a little palpate of the abdomen while she's there quickly?
At the Perth Zoo, Peter is performing a full health check on tiny cotton-top tamarin monkey, Livia.
We're running out of time and we really need to get moving. Feels okay.
All good?
Yep.
Over.
My next job is to collect a blood sample from Livia. The vein that I'm aiming for is extremely tiny and I can barely see it, so I'm relying on feel to know where it is. So I'm feeling for the pulse of her artery. I know that the vein lives next door to that artery, so I'm aiming for the vein. I can feel the pulse at the moment, and knowing my landmarks, the vein should be next door to it. Hopefully I'll get it in.
If she gets the all clear, the plan is to eventually move Livia and her sister into a public display area.
The next step is probably the most gruesome.
Peter now needs to check for the potentially fatal disease tuberculosis.
We're going to give her a tiny injection of tuberculin into each eyelid. That's to see if she is carrying the organism. It is something that primates can have, including us, and can carry without us knowing, and we can see signs of ill health later on, and it's something that we want on a screen for her protection and her safety as well as ours. Injecting it now into her eyelid. What we're going to be looking for here is if she reacts to this. If she has the organism and her body has an immune response to it, her eyelids will swell over the next couple of days, and that will be our answer. Her right eyelid. You can see the eyelid swell as I'm injecting it, but that's not the swelling that we're going to be looking for. That'll go down very quickly. It's gone well. She's looking healthy and fit, and it's time to get her back in her enclosure. Now we're conscious of time. The longer she's under, the more risk we have, so we want to wake her up. We're just going to position her inside the pet pack as she recovers.
So if she wakes up quickly.
I need to make sure I'm able to get her tube out when we're ready. So as she's waking up, we're just giving her a bit more oxygen. Because she is so tiny and has such a fast metabolic rate, it's important that she eats very quickly after this procedure as well. So once she's awake, what I'm going to be wanting her to do very soon after is to eat something that has a bit of sugar in it so her glucose goes back to normal. I know. There we go. There we go.
Now that Livia is waking up from the anaesthetic, Peter will have to wait for the results of the blood tests and hope that there's nothing abnormal.
We've got to get a move on with the process now. We want to get her back into her exhibit as soon as we can.
On the Gold Coast, 13-year-old Border Collie Diesel has just undergone an MRI, and a nervous Alex and Gerardo are about to find out the results from specialist Peter Barron.
Hi, Gerardo.
There's a smile.
Yeah, there is a smile. No, it's good news. Yeah, no, really, really good news for you. So, yeah. Ooh,
it's good.
So this is his brain sitting in the middle here, and all of the balance centre is towards the back of the brain. And so we want to have a look at his ears down in here, and certainly his middle ears look okay. So when we have a look at this, there's no tumours, there's no stroke, there's no ruptured blood vessels. That all looks really nice and fine.
It's a huge relief actually to know that You know, we've ruled a lot of those big things out that I'd be worried about, especially brain
for sure.
tumours. So,
yeah, at this stage, I think there's a really, really good chance that, you know, he's got this idiopathic geriatric vestibular syndrome. We don't know what causes it, but the vast majority of dogs get better with it.
So maybe he just needs a bit more time?
Yeah, lots of TLC at home. He may have a recurrence of episodes, but, you know, knowing that there's no structural lesion, no tumour in his brain or anything else like that, you know, there's a good chance he'll get through. So.
Oh!
Yeah, great news. Really, really good news.
That's so good.
Thank you.
Can you take him home? I was pretty sure that we'd be taking him home.
Oh, I wasn't. The MRI has given me an answer. Hey, matey. It's good to see you woke up okay. The plan of attack is take him home and continue to take care of him, making sure he's comfy and making sure he doesn't feel nauseous. Hey, I know you don't feel so good, but now we know that there's nothing bad going on in there. It's just a matter of time now until you get better, hey? And I suppose just treasuring the moments I have with him moving forward now. It's okay, good boy. Slowly, there we go. It was a real shock to the system and it really kind of brought me back to cherishing him and what he provides me. We might have to carry you, hey? Oh, I gotcha. Like a big baby. Get you home, get you comfy in bed. You've been a very brave boy today.
Come on, little guy. Your mum and dad are very worried about you.
In Bondi, Kate is desperately trying to save Poncho.
Hello there.
The little rabbit has a massive obstruction in his intestine. He's stopped eating and he's close to death.
We need to rehydrate Poncho. He's really in shock and he's really dehydrated. So much fur. Want it further on the edge, you reckon? So the best thing I can do now is put in a drip. Okay, come on, little mate. Let's just get this IV in. There we go, okay. What I'm really hoping the fluids will do is potentially move that obstruction. So the more fluid that we can actually give him, especially IV, it just basically means that the intestines are going to be a little bit more hydrated and it's going to mean that they're going to be able to function a little bit better. Come on now. Okay, okay, perfect. Let's do this. Let's put this under here like this. You got that?
Got it, yep.
Okay, cool. We've done everything we possibly can for Poncho medically. Now it's just a matter of playing the waiting game. Hopefully we can get you through this, mate. Let's put you back in your little bed. Get you back on your heat mat. I'm crossing all of my fingers and toes that this drip is going to get these intestines moving. All right, do you want me to wrap you up? There you go. Every hour, I think that Poncho potentially is not going to survive. So if he can survive until the morning, I'm going to be really one happy vet.
At Perth Zoo, it's the day after Tamarin monkey Livia's full health check. Peter has come to see his little patient and keeper Jenna.
So how's Livia going today?
Really, really good. Livia looks bright and alert. She came back straight away for some food and straight back into her conditioning cage.
You can definitely tell when she's happy, when she's a bit inquisitive. So it's all looking like it's really good news. Her blood tests, we've got the results back and she's all normal. Having a look at her today, I'm not seeing any reaction with her eyelids, so I don't think she's got tuberculosis. She's recovered well and looking happy and she's in tip-top health.
Livia will soon go on public display, but for now she'll stay in a private part of the zoo with her sister.
She's housed off display where we're breeding many different animals and housing many different animals and part of the zoo that no one normally gets to see and somewhere with that we're contributing massively to saving wildlife.
Poncho! Look at you! Hello! I'm so glad to see you!
Next morning at Kate's Bondi clinic, Poncho the rabbit has made a remarkable recovery.
You're a little fighter, aren't you? A little fighter. I am absolutely speechless. I didn't know that I would find an alive rabbit this morning, and he's up. He looks well. It's just miracles can happen. Do you think we might be able to get you out and have a look at you? Your mum is on her way in and she's going to be very, very happy to see you.
12 hours ago, Poncho was suffering from a major intestinal obstruction, and Kate did not expect him to live.
You're looking so much brighter. I've given the P-Man a lot of fluid overnight. It has worked absolute wonders because he looks great this morning. It's feeling a lot better, isn't it? Yesterday we had quite a hard lump right at the top. He was quite bloated at the top of his tummy there. That was a result of the fact that nothing could actually pass through. What we can feel today is that it's a lot softer and a lot doughier, which is great. It's how it's supposed to be. We might just have a quick listen to your gut sounds. This thing's moving. He's pooed, he's eaten, it's just getting better and better.
Poncho's owner, Sophie, is on her way in, anxious to see how her precious rabbit is going.
I think she's going to cry from happiness. She is going to be so happy to see Poncho alive this morning. I can hear those gut sounds from here. And your little nose twitch, you didn't have that yesterday. Whoa! Oh, hey, Soph! Look who's here!
Oh, Baba!
Hey!
Oh, how's he doing?
Oh my goodness, Soph. I can hear gut sounds from here, which is amazing.
Oh, little Bob.
I walked in this morning and I was so worried about what I was going to find.
Yeah.
He looks like he's eaten. I left him with some stuff overnight and look at his face.
Oh.
His temperature's come up.
Yeah.
Heaps, so that is great news.
Oh.
I feel so relieved. I actually was really worried last night. It was a little bit grim, so I didn't know how he'd go overnight, but he's looking a lot better, more bright-eyed and yeah, eating and yeah, a lot more happier, so I'm really relieved.
Look at him. He looks so much more alert as well.
I thought he wasn't going to make it.
So did I.
So good being able to hold him and cuddle him, and I can't believe it. I actually can't believe that he made it through the night, so I'm really happy.
You like the banana?
Look at him.
I'd prefer you eat hay, but you can have a little bit of banana.
As long as he's eating something.
As long as he's eating something right now. Here you go, little mate. Look, strawberry.
Little sweet tooth,
Can't talk, eating.
Just can't believe it.
Poncho has survived a major health crisis in the last 24 hours. He's given us all such a scare. It's time for him to go home, where I know Sophie is going to give him a lot of TLC, and he totally deserves it.
He's a little fighter, little Ponch, but the staff here have been so good, and yeah, Dr. Kate, I can't thank them enough. It's been great.
Thank you.
So yeah, call me if you need anything.
Thank you so much.
See you, little guy. Bye. See you guys.
Bye.
I'm really impressed with how he's going.
On the Gold Coast, it's a special day for 13-year-old Diesel after he was diagnosed with geriatric vestibular disease.
Guess we're heading today. We're heading to the beach, Diesel.
Gerardo and Alex are treating Diesel to a special outing to his favourite place.
I can imagine the inner him is like, oh my God, the beach again. He loves the beach.
You just see in his eyes how much happier he is.
Mm.
Whoa! He just needs a bit of help.
Yeah, he's got a permanent kind of tilt to the side, but it's so much better than what he was.
Yeah, that's just how you see the world, isn't it now, Diesel?
Yeah.
Hey, it's just kind of this way up.
But he's doing all the things he needs to do. He's eating, he's no longer nauseous and sick.
He's doing so well.
Yeah. Well, much better than what I originally thought he would do, hey?
Yeah. Oh, yeah.
Diesel's recovery has actually been a lot less traumatic than I thought it would be. I was steeling myself for a deterioration, but he's actually just been really steady. He's eating, he's happy, he wants to walk around, so it's the best that I could hope for, and despite the fact he might stumble a little bit, there's no loss of happiness in his life there.
So good to be able to bring him out after all this time.
Yeah, he loves being out here today.
The beach is a big part of our life, and being able to bring him back down here to where he really feels the happiest was something we've been looking forward to for so long. He's just loving being out here. And really, sometimes you just got to stop and think, you know what? This time is precious that we get to spend with our animals. I think it's brought us all closer together. It's coming through.
I've got you. I've got you. All right, got you.
Oh, he's awake. Hey, mate, he's awake.
At the Animal Emergency Service on the Gold Coast, the team is dealing with an influx of patients from a heat wave, and bearded collie Murphy has just been rushed through to the treatment room.
Yeah, it's a hot day out there. Hey.
Dr. Alex Hynes and Dr. Gerardo Poli start working on him immediately.
Murphy collapsed, he's non-responsive. At this stage, we don't know what's going on with him, but whatever it is, he's in a lot of trouble. He's got a temperature of 40.6. Oh, man. As soon as we start to look at Murph, we realise that he's got a high temperature. And my biggest concern on a hot day like this is that he's suffering from heat stroke. The first thing we're going to need to do for him is we're going to need to cool him down. And the best way we can do that is get the hose and wet him down all over. How you doing, Murphy? You're still there. You know what's going on. Hey, mate. And we still don't really know what happened with him, do we?
He's been at home all day in the air conditioning.
Okay, so he's not your typical heat stroke patient then. So his temperature's actually going up, even though we're cooling him down. We're going to have to do something else to try to get this temperature down. We're 5 minutes into the cooling process, and rather than the temperature going down, Murph's temperature is actually going up. It's now 41 degrees. Once the temperature goes over 41 degrees, organs start to shut down. This is life-threatening for Murphy now.
Cold air on him, that will help. Has the temperature coming down at all?
40.1 now, so it's coming back down.
With Murphy slowly starting to respond to the treatment, Alex brings in his owners, Rosemary and Chris.
Here's my most precious boy.
So what was the first thing that you noticed that wasn't right with Murphy today?
That he was having more trouble than usual getting up. And when I tried to give him a bowl of water, he sort of half looked at it and he couldn't, so I got a spray bottle and I was spraying water into his mouth.
Yeah.
To try to keep him hydrated.
Yeah, because it's such a hot day out there today.
Yeah, we've had a fan, I've been spraying him all day.
Yeah.
That's when I noticed that his gums were really red.
Yeah.
And I thought, that's not right.
Murphy has a long history of health issues.
He's had prostate problems, he's had the lymphoma, he's had tick.
The tick.
He has paralysis of the larynx.
So he's defying
He's a
the
fighter.
odds.
He doesn't want to leave because he lives the life.
Yeah. Chris and Rosemary have told me that Murph's been recently diagnosed with laryngeal paralysis. That's significant because it's going to impact the way he's able to cool down. Dogs cool by panting, and so if he can't pant effectively, then he's not going to be able to cool his body down. Really what we'll be trying to do is to see if we can get that temperature down, get him stable. We're going to transfer Murph into the intensive care unit because he's going to need the highest level of supportive care and a nurse with him around the clock.
You're a brave boy, okay? Well, Mama, you gonna be better?
I'd love to be able to give Chris and Rosemary some reassurance, but Murph is in really bad shape, and I don't know if he's even going to make it through the night.
If it goes wrong, then at least he went out trying.
Big day today. Hope we don't get bitten.
In Sydney, mobile vets doctors Alison and Audrey Shen have received a call out for a new arrival.
We're going to see Douglas. He's a baby Labrador puppy. This is the second puppy vaccination.
So we'll see how he goes. Very well-behaved puppy, but we never know.
Hi, come in. This is Douglas.
Hi, Douglas.
Hey, come on.
Hi, Dougie. All right, how old's he now?
He's 10 weeks.
10 weeks.
10 weeks.
Iona has had Douglas for only a fortnight, and today he'll be getting his first health check.
Hey? Ooh. What was that?
Douglas's housemate. That's Pepper.
Hi, Pepper. Very loud.
Very vocal.
Pepper is an Alexandrian parrot.
It's a very unusual dynamic to have a puppy and a bird in the house together. Ouch.
Oh.
They're almost like brother and sister now, so I'm interested to see how that progresses. So do they get on?
Yeah.
Keeping a watchful eye over there, isn't she?
Yeah, she gets a bit jealous.
Oh, can we touch your brother then? 1 minute.
She's very loud. And then I've got Douglas. I thought he would be a nice match for Pepper. Labrador's quite friendly, so they keep the household fairly alive.
Hello, Dougie. All right, shall we have a look over you? The sister's here for support, look at that. Taking care of your brother. Let's have a listen to your heart, Dougie. It's all good. Chest sounds clear, heart's great. The ears are looking really good.
That's good.
Let's have a look at your eyes. Okay, nose. Any coughing or sneezing?
No.
Okay, and now we'll leave the nasty deed to Auntie Audrey.
Uh-oh, Douglas.
How come I always get the dirty work? I'm always at the butt end, aren't I? Auntie Audrey does the dirty business. Look what we're gonna do to your brother now. What do you think, Dr. Pepper?
Oh, no. Oh, that's disgusting.
That's been in places you don't want to know about. It's definitely a one-of-a-kind consult with Pepper on my shoulder. I feel like I've got a little assistance there.
Supervisor.
Just supervising everything, checking out the thermometer, making sure everything's all normal. Very cute. Sorry, baby.
It's okay.
Sorry, baby. Oh, I know. What are we doing, Pepper? 38.3, all normal. You don't want that, Pepper. It's been in your brother's bum.
I just...
With Douglas's health check all good, it's time for his vaccination.
So he's having the C5 today, which covers kennel cough. So you can go and play with your friends. Okay, you're gonna be a brave boy. It's a little mosquito bite. Little mosquito bite, baby. Be brave. Be brave. Good boy.
Good boy. Good boy.
And that's it, baby.
Well
what
done.
a brave boy. Oh, look what Pepper's done. Oh, no. Did you poo on me? Bless the vet.
Oh, Pepper.
Hey?
It's gross.
So I get the bum thermometer taking and now I get poo on my shoulder. Why do I always get the good stuff? Now it's time to clip your nails, Pepper. You ready?
Clip your nails. You don't
now
have
we're
to
gonna
do
clip
it.
your nails. Oh, how are we gonna clip your nails now, Pepper? Come back.
She knows. Yeah.
Come on. Come.
In Melbourne, Simon is bringing Hugo into the Kingston Veterinary Hospital to see Dr. Danny Dusek. The 5-year-old boxer Staffy Cross is a bundle of energy.
I know you want to say hi, you have to wait. He's full of beans, he's always charged up. Never settles down, wants to greet every single dog you can imagine. Big bundle of fun.
Come through, Simon.
Come.
Hello, how you going, Simon?
Brilliant.
You
Yourself?
good? So Hugo just loves everyone and has to smooch everyone. Full of energy, just endless amounts of energy. Hey? So what's brought you in today?
Well, he's got this little lumpy on the side of his neck, a little bit of a growth.
How long ago did you first notice that?
Probably within the last 5 to 6 weeks, somewhere around there.
All right. And has it changed much in that time?
Not particularly, no.
Okay.
Maybe just a little bit more firmer
Okay.
than
all
anything.
right.
Fearing cancer, Simon is trying to stay positive.
I've had a dog pass away from lymphoma, and that started with a little lump, and that then progressed to chemotherapy and the whole lot, and I'm just hoping it's nothing as bad like this for him.
I can feel the lump there. It's quite fixed in that subcutaneous skin. It's not adjoining the sort of underlying tissues, which is good. The location of the lump makes me want to make sure that it's not the microchip. Beautiful. Microchip's way out of the way of that lump, so that's good. We'll have to pop a little needle in there to see what cells we get out, see what that could be. So hopefully it's nothing sinister, but we'll just have to check and make sure nothing going on there. Simon is putting on a real brave face today. He's a very stoic character, but I think underneath all that he's a little bit nervous about what this lump could be. The concern is potentially cancer.
Okay, mate.
In Sydney, Labrador Douglas is exhausted after his vaccination. And now Audrey and Alison are about to trim his noisy housemate Pepper the parrot's nails.
Okay, I need to be quick about this.
Bit of a
Onto
teamwork
the
here.
hands. Over with the towel. All right, sweetheart, I know. Let's have a look-see. The towel gives us a little bit more security with holding the bird. It helps keep the wings and the legs in close. It also can be used to cover their eyes a little bit so they don't freak out too much.
Yeah, reduces the stress level.
Yeah.
Good
Right
girl.
there, baby.
It's okay. Good girl, sweetheart.
One.
Ooh, they're sharp, aren't they?
Good girl.
Okay, let's see the other foot now. Down, one to go.
So trimming the nails is quite important, especially in the domesticated bird.
Sometimes it can overgrow and dig back into the foot.
Yeah. Or
but
they can have
there's-
problems perching onto their branches, so quite important to keep them nice and short regularly.
Good girl.
So this can be quite a stressful process for most birds. I mean, they're in a towel, they're almost a little bit upside down, so we want to make that as quick as possible and less stressful, so next time we can come back and do it again.
It's more of a positive experience.
Try and make it as positive as possible.
And we've got a wing.
Good girl.
And we're all done.
Good job.
Well done, go team.
Good job.
Forgiven? Forgotten? So I love these kind of consults that we did today. You know, you've got two animals, a bird and a dog, and that dynamic's really cute. It's a bit of fun, it's a bit different. So
I think that's why they need a mobile vet, because it's can you imagine bringing all those animals to the hospital and all of them climbing all over each other, being quite stressed.
Yeah.
So it's perfect. We love doing these consults.
And we're off.
That's a wrap.
All right, baby.
On the Gold Coast, Murphy is still in intensive care after collapsing at home with a dangerously high temperature.
It's not great news this morning for Murph. He's now on oxygen. We're nebulising him to try and open up some of his airways. He's really flat and he has made no attempt to get up. He's just right down the end there.
It's been an anxious time for Murphy's owners, Rosemary and Chris, being separated from their much-loved boy.
Angel, that's my most precious boy. Hello, babe.
I think it'll be really good for Chris and Rosemary to spend some time with Murph, and I'm hoping it's going to lift Murph's spirits as well.
I don't feel well. I want to go home. I know. I want to go home.
After that, they're going to meet with internal medicine specialist Pete Barron about the x-rays that he took this morning, but it's not good news.
There's certainly changes in his lungs. Now, instead of the lung being air-filled, there's pus and fluid building up in there. He's got a degree of laryngeal paralysis, and I think that that's predisposed him to aspiration pneumonia. Aspiration pneumonia is a very serious disease, and we definitely see animals who pass away with this condition.
I really can't face that. I hope he makes it to his 40th birthday. That's what I really want.
All right, so we'll just pop this little needle in. I'm sorry, it's just going to be a little bit of an ouchie. All right.
At the Kingston Veterinary Hospital in Melbourne, Danny is taking a sample from Hugo's suspicious lump.
Getting a needle sample from the lump can give us information. Sometimes we can get a definitive diagnosis. We know exactly what that lump is, but then more often than not, it's inconclusive and we need to do more tests. Doesn't look like we're getting a lot out of that. So we might find it's not exfoliating well, not getting many cells, but we'll still have a look under the microscope just to make sure that we're not missing anything. All right. So unfortunately, the cytology sample is inconclusive. We haven't got a lot of cells on there to look at. This mass just doesn't want to let go of cells for us. So basically the next step to find out what this lump is would be doing surgery. So the pathologist can actually look at the tissue, slice it all up and see what cells we've got and whether they're benign or nasty cells.
Okay.
So that would be the next step. Unfortunately, going to have to put you under an anaesthetic, my friend. Oh, darling. I can tell Simon's quite anxious about what this lump is, and that's understandable considering what his last dog's gone through.
See you later. Hey. See you later.
Take good care of your mate, all right?
Obviously, I was hoping not to go down the path of surgery, but it is what it is, and sometimes it's for the best to actually see what it is rather than guessing and seeing if it does grow bigger or not.
Hey, baby.
Back on the Gold Coast, 13-year-old Murphy is fighting for his life with a potentially deadly form of pneumonia.
Just like in humans, pneumonia is really serious, particularly in the elderly. Murph's like a 90-year-old man. So if he's suffering from pneumonia, this could be life-threatening.
Murphy has been put on an immediate course of antibiotics, and the next 24 hours will be critical.
You all right? Mummy and Daddy and her are going home now.
Owners Rosemary and Chris are staying optimistic their boy will pull through.
You know, it's not great news, but at least...
Not great news, at least it's something's treated.
Something, exactly. It's something that we know we've got a plan now, and we can just see how he responds to the antibiotics.
You know, my dogs are always my puppies. It's like so many people with their children, he's still my puppy. Murph is a fighter and he wants to get as much out of this life as he possibly can.
It's okay. You hang in there.
How you going, Matt?
Yeah, good.
At the Perth Zoo, Dr. Peter Ritchie is checking up on an unusual patient.
And who have we got here?
This is one of our field dragons, Gizmo.
Gizmo the frill-necked lizard is heading to a new home. But first, Peter must give him a preliminary checkup.
Where's he going?
He's heading to Melbourne Zoo.
Matt is Perth Zoo's senior reptile keeper. He's also Peter's brother.
The main reason I'm here today is to have a look at his teeth, and he has got a tooth missing down the bottom there. I don't think I want to do too much with him now because it's probably going to be painful and potentially I could lose my finger in there. I think we should take him up to the veterinary hospital and anaesthetise him, then we can have a look at it a bit better.
Sure.
How's he been going otherwise?
Oh, he's great. He's been behaving pretty normally. We haven't seen any issues with his mouth, and this time of year he spends a lot of time outside in the sun.
Okay. He's a good-looking lizard. He definitely feels in good condition. Just having a look at these little nails here. Sometimes we get to see little nail issues and claw issues with these guys, but he's all looking okay. We'll get him up to the vet department and we can have a look at you.
But anaesthetising Gizmo safely is going to be a challenge.
Being a cold-blooded animal, if he's not at exactly the right temperature, the drugs won't be effective. Too cold and he basically won't have any response. Too warm and it's too dangerous.
Hi, Kate, how are you doing?
Hey, Margaret, how are you?
In Bondi, wildlife carer Margaret has arrived with an unexpected patient for Dr. Kate Adams.
You got something for you today.
Thank goodness.
A little fur baby.
I love your surprises.
Yes. Have a look today.
Oh my goodness. Come on in. Most of my days at Bondi Vet are taken up by cats and dogs. So when I get to treat Australian wildlife, it's such a bonus.
This is Wilbur. So Wilbur's a 10-month-old baby wombat. Hi, Wilbur. Say hi to Kate.
Wilbur, look at you. Hi, I'm Wilbur the wombat.
Wilbur's a pouch baby, and the mother was a roadkill, unfortunately.
Oh,
yes.
I've got a real soft spot for wombats. They were one of the first animals that made me want to be a vet. I could cuddle Wilbur all day, but he's actually here for a health check. So we've really got to look and make sure that Wilbur is going okay. Is he eating well?
He's eating quite good, grazing out now. He's just recently been introduced to what I call the junior burrows. He's learning to dig and he's eating the dirt and he's getting his gut flora. But I just noticed that his claws are wearing down quite a bit and the little claw on the side, here's a mark.
Is this the bit that you were quite worried
I was
about?
a little bit worried about.
Fine, it's at the cuticle there, so that'll heal itself. He has these giant claws that are just starting to grow. Wombats use those to burrow and find food. I'm going to get you to hang on to him. Okay. Turn him around. I know, Wilbur. Come on. Hey, Wilbs, can we just have a look at your little choppers?
I know, I'm just looking.
Unlike humans, wombat teeth continue to keep on growing, and it's by eating that they actually grind their teeth down. We need to make sure that they're wearing down just as they should be.
I know, you little monkey. Hang on, sweetheart.
Wombats have long oral cavities and they've got chubby little cheeks, so it's quite difficult to get in there and have a good look.
So you can see that they're quite flattened at the top here.
Yes.
Right, so they're grinding down really nicely. You've obviously been giving him quite a lot of hard things to chew on.
Wilbur is so cute. When you see wombats up close, they make your heart melt.
No, you're just like a little regal wart. Just having a listen to his heart. It's beautiful. No murmur, heart rate's good.
He has been a little bit itchy, and I wasn't sure whether it was due to the digging.
Australian wombats are really prone to getting a thing called sarcoptic mange. It's a little microscopic parasite that burrows into the skin and makes them really itchy.
You know, his fur is a lot shorter around this back end than up around here, so you can just feel how it's quite lush around up here, and it looks like he actually does do a little bit of rubbing down this back end. I personally think it's mange.
Luckily, sarcoptic mange is treatable. We use a very similar product to what we use in cats and dogs to treat fleas and ticks. So, Margaret, I am going to actually give you some things to treat sarcoptes.
Okay.
All we really need to do from here is just make sure that everything's tracking along okay.
Thank you so much, Kate. Really appreciate it.
See you, Wilbur.
Say
See
bye.
you, Wilbur. You've been very uncooperative.
Not the best of patients, no.
He's like,
all right.
I want to get back in my bag.
I'll put you back in your bag and then
See
you
you,
can
Wilbur.
be quiet. There you go. Whoops. Come on, Wilbur, cooperate here.
Wilbur's doing a little somersault here. Oh, he's so cute.
Hey, Hugo, how you going, mate? Oh, we're already pretty zonked, aren't we, hey? We'll get that lump sorted, hey, mate? We'll find out what's going on there. Good boy.
In Melbourne, Danny is about to start surgery on boxer staffy Cross Hugo to remove a suspicious lump.
The concern is potentially cancer, so that will take getting some answers from the laboratory, and then we'll have an idea whether this is something that's more sinister or whether it's benign. Okay, you guys happy for me to cut?
Happy.
All right. The most labour-intensive and time-consuming part is cutting down and undermining into those deep tissues underneath the lump. So just getting through that thick skin, and now we're just working through all the fat.
Vet nurses Camilla and Hannah are assisting with the surgery.
I can feel that lump now. It's really important that we get all the deeper tissues underneath that lump out, otherwise we're likely to leave cells behind. A lot of people think of a lump removal as literally popping out a little lump. It's a bit more complicated, and we need to get margins both around the outside of the lump and underneath. So we've got that lump out, so hopefully we've got a benign mass. And that will be going to the lab for further analysis. Almost done there, Hugo. Just got to start closing you up and you'll be good to go. Have a bit of a scar, but he's still going to be a handsome boy. I know Simon's back at home probably feeling quite anxious considering his history. So it's a little bit of extra pressure today.
He's doing okay underneath there.
At the Perth Zoo, special preparations have been underway for a risky anaesthetic procedure on frill-necked lizard Gizmo.
Our patient today has been sitting in a hot box for a short period to warm him up to his preferred body temperature, which is around 28 degrees. So I'm going to give him his injection of his anaesthetic medication. I'm aiming for a blood vessel that lives just below the spine and his tail running along here. There we go. Now that he's warm and he's had his medication, he should go to sleep very slowly. Reptiles metabolise drugs very differently to other species, so we rely on external temperatures for the chemical reactions to happen in his body. To keep his appropriate temperature, we've used our bear hugger device, and this is basically a pillow inflated with hot, warm air. So without him being warm enough, he's not going to metabolise the drugs the way we want him to. Now I need to get my endotracheal tube in. Reptiles are difficult to monitor under anaesthesia as well. That's better. All right. One easy way to monitor heart rate is actually putting a little probe on his eye, which I'm doing right now. So we're now hearing his heart rate through his eye. This is amazing. It's a very sensitive microphone, hearing the whooshing of the blood moving through his blood vessels in his eye.
With Gizmo safely anaesthetised, Peter begins a physical exam before moving on to the dental check.
The thing that we're looking for when we're having a look at his toes and his legs is signs of gout. Lizards are susceptible to gout, so we'll ensure he doesn't have that before he goes.
Gout is common in reptiles, causing stiff and swollen joints. The painful condition is caused by a build-up of uric acid in the blood.
He's looking great. Everything's moving all okay.
With the external exam done, Peter wants to make sure there aren't any hidden issues.
So we're about to take some x-rays of him now. His skeleton's looking beautiful, which is a really good thing, and everything's looking normal at the moment.
With the physical check complete, Peter can now move on to Gizmo's important dental examination.
So we're just doing our dental exam on our little frilled neck lizard, and along his top row of teeth, he's actually missing a small segment of jaw. So there should be teeth from here down to here that are now missing. And he does have a bit of gingival recession, so the pink tissue over here should be a little bit higher up along the line of his gums up here. We're just taking some photos to document his teeth so we can compare them from previous photos.
It's a lot less red.
Yeah, it's not progressing, and we're actually seeing some improvement on this side, which is really good. This little guy's in great shape. It's time to wake him up.
But Peter can't relax just yet.
One small problem with reptile anaesthetics is in recovery, they often will stop breathing. One thing that will get them to breathe again is actually increasing carbon dioxide levels in their system and also decreasing the anaesthetic in their system as well. So it's a bit of a balance of giving him breaths to get rid of the anaesthetic, but not too many that his carbon dioxide levels don't go too low. Hey, little man. How you going? You waking up? He's looking okay. He's doing his normal reptile thing, and they like to take a little bit longer to wake up from anaesthetic, but he's started to regain some of his reflexes now. He's recovered well and looking happy and in tip-top health.
In Sydney, doctors Audrey and Alison are making a home visit to see one of their favourite patients.
We're here to see Scaramouche today. Jackie's the mum, and we do see Scaramouche quite often. She's a very good client of ours. We're like her aunties, really. Auntie Audrey and Auntie Alison.
Hi, Mooshy.
Hi, Ali. Hi, Audrey.
How have you been? We've missed you.
Scaramouche is 2. She was flown down from Brisbane, and Audrey and I went to the airport and collected her.
I'll just have a listen to your chest, make sure the breathing's all good. There's so much fur here, I can't find your chest.
That's good, it's all nice and clear.
Oh, good.
Everything sounds great. Her heart's a little fast because she's a little bit nervous, but otherwise clean bill of health there.
But the girls aren't here for just a health check. Scaramouche needs help with a rather delicate problem.
Scaramouche needs regular grooming. She needs procedures done to her fur, which we call a bumzillion.
That's basically just a hygiene trim. So around her bottom area, keeping the hair nice and short. Because of all her hair, especially with this breed being a Persian, that tends to cover up the bottom part. And so urine and feces can get stuck to it.
Yeah, the cat litter as well.
Yeah, and so all that bacteria sitting there isn't very good. So just to clip that hair away so that she can toilet nicely and cleanly.
Yeah.
So let's have a look. You just relax back there, honey. Oh, you can see there's actually litter and feces stuck there. So we'll give her a bit of a trim.
Oh, you're being so good.
She's quite used to this, isn't she, Jackie?
Yeah, she really doesn't mind that at all, actually. This is not a job I can do single-handed or at all.
It's a 2 to 3 person job, isn't it?
Here we go. All done.
Very good.
So that's the bumzillion complete.
That's fantastic.
Hey, new
Thank
woman.
you. She's my baby, and I love her to bits. She's just makes life worthwhile.
We've been slaving away in the kitchen and we made you some chicken treats.
Thank Auntie Audrey made you chicken treats.
Oh, thank you so much.
Thank you for being good today.
Hey, Hugo, how's it going?
He's good. He's up. He's awake.
Good boy. We're getting there, aren't we, hey?
In Melbourne, 5-year-old Hugo has recovered well after surgery to remove a suspicious lump from his neck.
So all that's left to do for Hugo today is apply a nice bandage for some compression around the surgical site to try and help minimise the swelling, because that area is a real high motion area of the body, so it's high risk for swelling after surgery. Okay, Hugo, I think the best way to get you up on your feet again is to bring your dad out here. What do you reckon, hey? Come on through. Here he is.
Oh.
There's that tail.
I like your vest.
So handsome, hey?
Oh,
You good boy.
you good boy?
Oh,
Yeah. Feel okay?
he seems really comfortable. He's just very sedate still, so
Still a little bit
I think
quiet.
it's going to be good to keep him nice and rested. The biggest challenge for Simon is going to be keeping Hugo quiet while this surgery site heals. I don't know how much luck he's going to have.
Can he eat tonight or not
I
really?
just give him a little bit. Wait till he's maybe a bit, well, he's perked up now that he's seen Dad. But yeah, just give him maybe half of what he normally has. So we've still got a few more anxious days waiting to get the pathology results for Hugo's lump so that we can actually find out what it is. Have a good night. If you've got any concerns at all, give us a call.
Will do. Thank you so
we'll
much
see you in
for
a couple of
everything.
days. No worries, Simon.
Cheerio.
See you later. Good boy.
Hey, mate, you're having a sleep. That's not what I hear. I hear you've been barking the place down, hey?
It's been almost 24 hours since Murphy was rushed into the Animal Emergency Hospital on the Gold Coast, barely conscious.
You look a bit brighter than the last time I saw you.
Murphy was diagnosed with potentially fatal aspiration pneumonia and has been started on a heavy course of antibiotics.
I think your mum's going to be very happy when she sees you. He's come off his oxygen, and that's a big milestone because while he's on oxygen, he can't go home. So getting him off oxygen, getting him up and around, having him eating, these are all the boxes we want to be ticking, and he's doing all the right things. Good boy. Can you walk? Come on, you can do it. When he came in, he was flat out, he was non-responsive. He's a good boy. Oh, a couple of steps. He's now able to get up, walk around with some assistance. You know, that's a huge improvement just in a really short space of time. Hey, it takes a lot of energy when you're an old fella, isn't it? Hey? Murph just keeps defying the odds. We really thought for this boy, this could be the end of the road. And he's just shown he's not ready to go. He wants to get home. Come on, Murph. Do you want to get up and have one more go? Good boy. Good boy. Oh. Yeah, you can. Oh, it's so hard on this floor. I know. How are we going to get you back to bed? And we have to carry you back to bed. People might look at Murph and think, gosh, he's still really struggling to get around, but these steps, these little steps are really quite significant for him. And, you know, this is progress. Lift him in the front, that's it. Good boy. There we go. Baby steps. Keep going, don't give up now. Oh, good boy. Okay, that was a big effort, wasn't it? I think Rosemary and Chris had almost prepared themselves that Murph may not go home, that this might be, you know, the final thing for him. Murph had other ideas. He's a real fighter, this boy, and I think they're going to be over the moon when they see him up and about, and he just wants to go home now. See, you've got to get strong. You've got to get strong for your mum.
Come on.
In Perth, Peter's having a day off and he's spending it at home looking after his menagerie.
Come on. I love it out here. We're on a small farm about an hour east of Perth. It's about 130 acres, and this is a place I call home. Sheila, come on. Sheila, come. We have 3 dogs. Each year I go help de-sex dogs in remote Indigenous communities, and each year I tend to come home with another dog. Cookie the galah came into the animal hospital as a stray orphan baby. He didn't have a home to go to, so I put my hand up to take him home. Hey, Cookie. How you going? Oh, gentle. Ow. I wanted to be a vet when I was very young. I remember one of my dogs getting bitten by a snake and passing away, and that was something that I wish I had been able to do something about. Becoming a vet meant I could do that for my own animals, and in the veterinary clinic I understand what they're going through because I've been there. You're right, come on, got some. I do consider them all pets. I mean, even the sheep come when they're called, so.
Peter has a soft spot for one animal in particular.
Guinea pigs. I just love them. At the moment, there's about 45 guinea pigs here. Guinea pigs are on the rodent evolutionary chain because of their teeth. However, a lot of other things about them are very similar to horses. Their dietary requirements is very similar to a horse. Their behaviours, in that, you know, you have a little stallion running around with his group of mares, and they're a herd animal that grazes, and I love them. It's not necessarily the animal I thought I would find an affinity with, but I do.
Peter is excited because one of his guinea pigs is due to have a litter any day.
This is Beatrice. I'm just having a little palpate of her abdomen, and at the moment I can feel there's one little head sitting under here, and I think there's at least another 2 on this side as well. I can feel another two heads here. The other reason I know that she's about to give birth is that her pelvis will separate in the week leading up to giving birth, and I can feel that that's actually happening at the moment, so we should be expecting little KV pups or guinea pig pups any day now. This is her 2nd pregnancy, so hopefully everything goes well. There's always a risk with birthing and pregnancy, so we'll be keeping a real close eye on her over the next week.
At the Animal Emergency Service on the Gold Coast, Rosemary and Chris have arrived, anxious to take home their beloved old boy Murphy.
Hello.
Hey, how are you?
Are you ready? Today's the day.
Yeah. Isn't it great?
Ready for your boy to go home?
You've done such an incredible job, especially the ladies down ICU. They are amazing.
He has become such a favourite, but Murph has really found his voice today.
I heard.
Yeah.
I'm not happy.
I want to go home.
Yes.
That's what he's been saying, and
Yes.
so the girls are like, let's get him home.
Take him away. Take him away.
Rosemary and Chris are determined to take Murph home today. Most owners, I would say, would not be able to look after a dog at home in this condition. But these guys are extraordinary owners, and they will give him round-the-clock care. Maybe the key is some love at home. Oh, he looks like he's sound asleep. We're going to give him a bit of a surprise, I think.
Oh, hello. Hello. I hear you've been giving everyone a hard time. You want to go home?
Time to go. 1, 2, 3.
Put those
Get back on
legs.
here, get your balance.
Get a little bit of circulation to those legs. Good boy. So Chris and I get Murph to his feet, and he's a bit shaky.
Slippery, slippery. Oh, I don't like
So
this.
hard on the slippery floor, isn't it? It was unbelievable. He just started to take steps by himself. I don't like to use the word miraculous, but this was a miracle. Yeah, you were determined you were going to walk out of here on your own, weren't you, Murph? He's like, I don't need a trolley. I got 4 legs. As we're going down the corridor, it's just the most extraordinary moment. He's going faster, he's getting stronger. Look at him. Look at that. Yeah. I just felt like cheering him on. Go, Murph. Come on. Let's go. Good boy. That's it. One leg in front of the other. God, that's so good. So good. I did not expect him to walk out, and I don't think Rosemary and Chris did either. It is just the most extraordinary moment. Look at you. You surprised me. You surprised me, you did. Okay. He just showed us when he put his mind to it, there was nothing going to stop him. He was going to walk out of there on his own. It's incredible. It really is. It's a great day for Murph. Team Murph. That was what it was. Team Murph.
Look at that face.
Really good. Star. He is a star. It's moments like this that I really believe in the power of love. There's not a single person in this hospital that hasn't been touched by what's happened today. All right.
Thank you very much.
See you later.
Boy, hey? Excited? See what the results are, huh?
In Melbourne, Simon and Hugo have returned to the Kingston Veterinary Hospital to get the lab results after Danny removed a suspicious lump.
Excited to see Danny? Yeah. You are, huh?
Simon's last dog died after losing a battle with lymphoma, so he's extremely anxious.
It is results day. We'll see. It is kind of itchy to know what's wrong, which way we're going to go.
Hello, come on in, Simon. Hello, Hugo. Hey, you good boy. Hey. So I see that the bandage didn't last you too long.
He wasn't himself with it on. Had to take it off.
Yeah, no, that's fair enough. I didn't expect it to stay in that position for very long, but just having a look at the wound, so it looks like it's largely healing up pretty good. This end certainly is looking a bit more inflamed and there's a bit of muck and discharge there. So I think best thing is to get started on some antibiotics to clear that up. We don't want it to obviously go deeper into the wound.
100%.
And obviously these little lumpy bumpies on either end will soften out with time as the sutures all dissolve.
It has come down a little bit since the other day.
Oh yeah, and any swelling is just going to continue to subside with time as well.
Brilliant.
So that's good. Now it's time to give Simon the results of the biopsy. I think Simon must be really anxious at the moment, just waiting to find out. I have fantastic news. The lump was just a granuloma.
Oh, how good's that?
So surgery has cured that, so that's wonderful.
Perfect. Hey, you hear that? Yeah, that's good.
So completely benign lump, nothing to worry about.
Brilliant. Huge relief. Couldn't ask for anything better. Best news all year, to be honest. Such a relief to know that he's okay and to know that everything else will be fine with him.
I'm just thrilled that it's nothing nasty.
Oh.
We're all thrilled with the results. It's fantastic to be able to pass it on.
He's got a nice wall wound to show for it.
Yeah, so good news. That's what we want.
100%. This smile that I have, it's going to last for months and months to come, I tell you. But knowing that he will be fine is brilliant. I've got him for a lot longer now.
Great result for you, mate.
Yeah, definitely was. Hey?
You take care now, and hopefully we don't see you back anytime soon, okay?
Thanks for everything.
See you, Simon.
See you later.
Bye.
Bye-bye. Come on.
Hey, ladies. I've got something for you to come and have a look at.
At the animal hospital in Perth, Peter has brought in a surprise to show the team.
Look who we have in here.
Oh, they're so tiny. Can we hold them?
We can.
Really sweet. Oh.
They're only a day old.
Hi, guys.
Come on. Last night, my little guinea pig, Beatrice, gave birth to 3 beautiful little baby guinea pigs, or pups. Beatrice is doing really well. She's recovered well from the birth and she's looking great. We can have a play and see if you can tell which sex they are.
What's this one?
That one's a girl. Can I have a look at this one?
Oh, my gosh. Too cute.
This one is a little boy. You can see his little willy there.
Oh, don't jump.
Right. Everyone in the vet hospital here has pets and everyone loves bringing their pets to work. And today it's my turn with my little pups. These were inside their mum less than 24 hours ago.
That's amazing. Too cute.
I've already named them. Their names are Hazel, Pom Pom and Barry. Once they're old enough, they'll be weaned from mum and they'll go to new homes, hopefully to live with some happy little kids.
At the Animal Hospital in Perth, Dr. Peter Ritchie's first patient has arrived, tabby cat Cleo with his owner Cheryl.
Hi, Cleo. Cleo's about 1.5 years old now. I got her as a kitten. She's a really lovely cat. She's really friendly and really affectionate. I really love her a lot.
But Cleo has suddenly developed a worrying lump.
Hi there, how are you going?
Hello.
My name's Pete, nice to meet
Cheryl.
you.
Nice to meet you.
We've got Cleo in here, I believe. And Cleo has a little lump, I understand.
Yes.
So when did you first notice
I
it,
first
sorry?
noticed it this morning.
This morning, right, yeah.
And then by the time I got, here it is.
Hey, oh yeah, I see.
A lot larger. And she's sort of, when you touch her, she starts sort of crying and she looks like she's really in
unhappy
pain.
about that. Has she had any fights with any other cats?
Yeah, about a week ago she had a fight.
It's a bit hard to know exactly what's going on without having a look underneath the skin, but if she's had a wound there from a fight, something that's not too uncommon is for them to get an abscess. So, but we'll have a little check over of her. So let's have a look at the front of you, my dear.
That's it.
Good girl. Have a sneak in with my stethoscope and have a little listen to her heart.
Hey there. I've been concerned because my first cat died quite unexpectedly. So when I noticed this large lump growing on her back, I thought, I better take it to the vet straight away.
Ideally, what we would want to do with her is give her an anaesthetic so that we can have a look at that lump a little bit further. I am really hoping that this is an abscess because if it's not, something that it could be is a cancerous lump. The main thing that we want to do today is investigate a bit further, make sure that what we're dealing with is actually an abscess, and if it is, clean it out as best as we can.
Cleo's such an affectionate cat. I really love her. She brings so much joy into my life, so I really get concerned when she's not feeling well. That's a girl. You're right.
All right, so let's get everything set up.
In Melbourne, Dr. Danny Dusek is joining a team of volunteers at Pets in the Park, a charity vet service dedicated to the animals of people who are homeless or at risk of becoming homeless.
Pets in the Park is everything that I signed up to vet for. I've always been obsessed with animals my whole life. And I got into veterinary science because I saw a homeless man with his dog and I desperately wanted to help and I could do nothing. And it really just sparked this desperation in me to be able to get some skills and help these people. So I love it.
Danny and vet nurse Serena's first patient of the day is 7-year-old Pitsy, much-loved companion of owner Mary.
How's little Pitsy going at the moment?
She's not doing too bad. She's here only for a checkup.
Wonderful. Hello, darling. Well, we're a bit nervous now. We'll just have a little listen to your heart, my love.
At Pets in the Park, vets provide medical and dental checkups, as well as vaccinations, antibiotics, and flea and worm treatments. Today, Pitsy is getting the works.
She's a good girl.
She certainly is.
Yeah. Pitsy, she's my darling. She's my little girl. She's such a part of my family. I don't know what my life would be without her.
So the heart and lungs sound good, so we have no concerns there today, which is great. Now just have a little look in that mouth. Yeah, so we've got a bit of calculus build-up. Pitsy's doing really well, actually. She's got a little bit of dental disease, but not too bad considering her age. So she is down on our notes that she's going to need a dental at some point, okay?
Yes.
Mary is an absolute sweetheart. You can see in her eyes the love and care that she has for little Pitsy. They've just got such a beautiful bond. It's tablet time, so I don't know how she'll be with the parasite control. I have got one tablet that I will maybe pop down her throat if you're happy.
Yes,
is that okay?
You should do,
all right.
yes. She knows she has to swallow the tablet. She doesn't love them, that's for sure, but she has to have them.
Pitsy is a little bit of a nervous Nelly, so we'll just take it nice and slow. You ready? I know, it's a big one. Down you pop.
Yep.
Well done.
Well done.
Oh, you were
Well
very
done.
brave. She was actually really good, so that was good result. You were so brave.
It's been great knowing the Pets in the Park. She's been looked after for the last 6 months. Otherwise, I wouldn't be able to afford the medication, and I'm very fortunate to have this chance in my life. Hey, you've been good.
Danny's next patient is much bigger than little Pitsy.
We won't get him up on the table. He's
Yes,
too heavy.
that's a good call. Hello, you beautiful boy. you excited or nervous to be here, do you think?
Nervous.
How you going, Nala?
On the Gold Coast, Ashley is keeping watch over her pet mini pig Nala, who's just given birth to 6 baby piglets.
Good girl. My friends thought having a pig was interesting, I guess, but I don't think anybody quite understands my little attachment to this pig. But to me, she's more like a dog or like an affectionate little animal. She likes to suck on my hand.
Ashley has asked Dr. Alex Hynes to make a house call to check up on the new mum and her babies.
Nala had come into the emergency hospital. She was heavily pregnant and Ashley was a little bit concerned, so she wanted her checked out. I was a little bit sad that I wasn't there that night. So when the call came in today, we don't normally do house calls, but I was like, I'm getting in the car and I'm going out there.
Hi, Alex. How are you?
Hello, good.
Thank you for coming.
That's okay. Can't wait to see Nala and her babies. When Nala came into the hospital, all anyone was talking about was this beautiful pig. She was just like a dog. She followed Ashley around the hospital and she was just so well behaved. Where is she in there?
Nala.
Hey, Nala, I can hear you.
Oh, she's feeding.
Oh, she is too. Nala, aren't you clever? Look at you. Hello, my dear. Look at your babies. There's 6 gorgeous little piglets. I just want to pick them up and give them a cuddle. But I have to resist because Ashley's told me Nala is very protective. So many different colours as well.
I know. Good variety.
Yeah, and all reasonably the same size by the look of it.
Yeah, there doesn't seem to be like a runt or anything.
Yeah, no, that's really good because these guys don't get a lot of chance if they're smaller because she goes down, they have a feed, and one of them's a bit slow or a bit weak for miss out. So that's really good. An even size litter is exactly what you want, so that's great. While I'm here, I really want to check out these little babies, make sure they're in good health, but this could be fraught with danger. Really depends on how Nala's going to react when I pick up each of these babies to weigh them and check them over.
While Nala is momentarily distracted, Alex jumps at the chance to try to take a closer look at the piglets.
Ashley, have you named any of them yet?
No, they don't have names.
No?
No.
And how many boys, how many girls have we got?
This is a little girl and this is the other girl.
And all the rest are little boys.
Yeah.
So while Mum's busy, we might have a look at each of the babies and see if we can do that before she comes back.
Cool.
All right. Pick him up. Oh, he's very sleepy. Sounds good. Oh, I quite like it when he's fast asleep. I know once he wakes up, he's probably going to have a bit of a squeal.
Yeah.
So we'll just look under his back end there. It's nice and clean at the moment. Look at him, he's fast asleep. Hey, while you're asleep, my friend, I'm going to pop you on there. Oh, this is great. Hey, he's even having little dreams. So he's 1.2 kilos.
Yeah.
Now that's really good. Anything over a kilo at this age is pretty good. But as I said, the main thing is that they're all about the same weight.
Okay.
That's what we're really looking for. Move on to the next little guy. Have a listen. Oh, here we go. I go to pick up the little girl and all hell breaks loose. Oh dear. Now we're not happy. Okay, she starts squealing her head off and Nala comes running.
At Pets in the Park in Melbourne, Danny and other vet volunteers are helping the homeless with their beloved animals.
The people that we see here, they love their pets more than anything on this earth. They'll do anything for them. They just want the best for them. It really gets me choked up because they may not have anybody and it's that pet that keeps them going every day. They will feed them before themselves. They'll go above and beyond for them. So it's such a privilege to be able to be there for them.
We've got Kane here, have we?
Yes.
Shane is next with his 2 dogs, 10-year-old Labrador Amy and 2-year-old German Shepherd Kane.
Hi, Kane. Aren't you beautiful? How's he been going?
He is perfect. I just brought him in for a checkup.
So he's had a good appetite.
Oh,
he's happy in himself.
Yeah, he runs. I take him for a swim.
Oh, you lucky boy, hey?
Well, let's check you over then, mate. Make sure there's nothing going on. Have a little look in these ears. Oh, excuse you.
Kane's like a teenager, he just mucks around. He goes everywhere with me, he sleeps on the bed if he wants to. Yeah, they're my life. And these people, they look after him really well.
All right, mate. Now we'll have a little listen to your ticker. Good boy. Shane's a real character, this big heart. Kane is full of beans and he's all about Dad. You can just see that they love each other so much. He's clearly very fit. Shane is doing everything to keep Kane in great shape. Oh, done, mister. Good boy.
Are you happy? Yeah, I know, yeah. It's fit as a fiddle. You'll probably outlast me.
Next is Shane's other dog.
Come on.
Labrador Amy.
Sit.
Hello, Amy Gill. Hi.
She's just over 10 years old.
Oh, you're a wise soul, aren't you, sweetheart? How's she been?
Well, she was 47 kilos last year.
Yep.
I don't know what she is now, but she's nowhere near it.
Okay.
She's lost a hell of a lot of weight. Put her on a diet.
You've been, oh, wonderful. Being overweight, technically obese, you can end up with lots of issues, including a decreased lifespan. So it really is important that we get her weight back under control. Have you had any lameness with her, any limping?
Yeah.
Yeah?
This one.
The front left one. Okay, we might actually have a look at how she's walking today.
Come on.
Okay, I'm just gonna have a feel of this front left leg then, if that's been the one that you've noticed that's bothering her. I suspect most likely it's the elbow, and it is really common in Labradors. Unfortunately, she's likely to end up with arthritis in that joint.
That's why I'm trying to get the weight right off
Yeah,
her.
that'll help take the pressure off the joint. Certainly we don't want that getting any worse. Carrying all that extra weight is putting so much pressure through her joints that that's speeding up that process of osteoarthritis. So I'm just going to give Amy an injection, so that's just going to help with her sore elbow. It's going to give her some anti-inflammatory effects, so that'll help her, keep her a bit more comfortable.
My long term is just get as much weight off her as I can. Yeah, I've got to do what I can for her. You just got to look after her and do the right thing. It's all right.
All right, so a little pinch. Ready?
Yeah,
One, two,
she's
three.
all right with the needles.
Oh, darling. Oh, darling. Hopefully when Shane returns with Amy, we're a little bit more slender and hopefully she's a bit more comfortable in those joints now that we've started some medication for that.
All right, not a problem.
Sound good?
Yeah.
Beautiful. At the end of the day, at Pets in the Park, it just makes you feel so lucky that you have the skills that you can actually help these people and their pets. It's a feel-good thing. I love it. Good job.
Is this Cleo? Is she a pretty cat?
At the animal hospital in Perth, Peter is about to anaesthetise Cleo the cat, who has a mysterious lump on her side.
Once she's asleep, we can investigate the lump a bit further by making an incision with a scalpel to see what tissue lies underneath.
Vet nurse Jordana will be assisting.
I'm just going to clip the hair on the front of her leg so we can find out where her vein is. All right. Yeah, a little prick. The procedure I'm about to perform is potentially painful and I don't want her to be able to perceive that pain, so these drugs will make her sleepy and make that perception of pain go away. Good girl, Cleo. You're being such a good little kitty cat. I'm not usually a cat person, but Cleo is a gorgeous cat. All right, almost done, Cleo. Anaesthetic drugs tend to lower the blood pressure. We're going to put her on a drip, so that's going to give her fluid into her vein, into that catheter I've just placed. That will increase her blood pressure and make the anaesthetic procedure more safe. All right, you getting sleepy? There we go. Good girl. My next job is placing an endotracheal tube. What I want to do now is make sure that the tube is in her trachea. As she has a breath, I should be able to see some condensation inside of that tube. So this little white thing here is just a sensor for carbon dioxide. So every time she has a breath, one of these blue waves will come up on our monitor. 1 second. Oh no.
Cleo is having trouble stabilising under general anaesthetic.
She has a little breath hold now. Been a little bit of a problem with Cleo's anaesthetic. She stopped breathing by herself. We're going to have to help her out here. Keep a close eye on that. It was something that progresses very quickly.
Oh dear. Now we're not happy. Okay. Oh, she comes.
On the Gold Coast, Alex is trying to check newborn piglets. But new mum Nala isn't happy about being temporarily separated from her babies.
Nala comes cannoning into the pen and it's pretty intimidating.
Nala.
Oh, Nala.
It's okay.
I think we've upset Mum a little bit. It's okay. They're all fine, Nala. You're a good mum, Nala. You're a good protective mum, but you're a little bit intimidating.
Yeah.
I say, sorry, Mum, and just let her get settled, but I want to have another go. Little one. He's just all right on a kilo. That was a good little guy. I know. I don't think I'll have any chance of looking. It's okay. So it's clear I'm not going to be able to pick up all these piglets. It's just going to stress Nala out too much.
Did you want me to grab the smallest one?
Yeah, let's try
He's
the
a sweet one.
Okay. Okay. I want to pick him up, put him on the scales and make sure he's not in the danger zone for weight.
It's okay.
Ashley, how about you put this one on the scales and we'll just see if we can get a weight. She's the smallest. Is it she?
It's a boy.
It's a boy. So, yeah, just under, so 900 grams.
It's okay.
Mama, there you go. Oh, she's quick. Well, that's good. At least we got the smallest one weighed. So there's 200 grams difference between the heaviest one and the lightest one.
Yeah.
So that is a little bit of a difference.
Yeah.
So whenever possible to see that for that little guy,
Yeah.
that he's putting on weight every day.
Okay.
Because if the others get bigger and stronger, he could end up missing out.
Yeah.
It's so easy for the little one to get pushed out the way, not get enough food and fall even further behind. And I really don't want that to happen to this little boy. He is super cute though. I think he's my favourite with his little curled ears.
Yes, very cute.
So I think if we keep persisting anymore, Ashley, Mum's getting really upset now.
Yeah, yes.
So I'm happy that we've weighed the tiniest little guy.
Yep.
And we've checked them all out otherwise, so let's leave it at that.
Yeah, that sounds
good. We won't induce Mum's wrath anymore. Sitting here with these pigs, I'm beginning to think that having a pet pig is not such a bad idea.
Would you like to see what it's like to actually have a full-grown pig inside the house?
It can't be that bad, can it?
Have you got a BP going? There's been a little bit of a problem with Cleo's anaesthetic. She stopped breathing by herself. We're going to have to help her out here.
At the animal hospital in Perth, Cleo the cat isn't breathing properly, and Peter is struggling to get her stabilised.
As you first enter anaesthesia, you'll breath hold. So at the moment, Cleo is not having normal breaths. And every time I press the bag, she has a little breath of oxygen going into her. So when she's not breathing, we breathe for her.
It's okay, Cleo.
Hey, sweet pea. She's just having little breaths in her body. Beautiful. She's breathing herself now, so I'll let her do her thing.
Now that Cleo's breathing has finally stabilised, Peter can start investigating the lump on her side.
I'm expecting to see a swelling underneath the skin, and I can feel that it is quite extensive.
But just as Peter is about to prepare the area for surgery, there is another scare.
This is not good.
Little Cleo's heart rate starts to drop.
She has got a little arrhythmia every now and again, but I think it's respiratory associated. Yeah, pop her just on half for a moment and we'll see how she goes. She's not got any reflexes, I don't think. So we have a little bit of a problem. The heart rate is dropping. That can be a side effect of the anaesthetic medications, and we've just got to get this period right to make sure she's at the appropriate depth of anaesthesia. Too deep and she's dead, and too awake, she's going to feel everything. And so there's that fine line that we need to get.
But before you go, I was just wondering, would you like to see what it's like to actually have a full-grown pig inside the house?
It can't be that bad, can it?
You'll be the judge.
All right, let's give her a try.
Okay.
At a home visit on the Gold Coast, Alex has fallen in love with a litter of new piglets. So owner Ashley wants to show her firsthand what it will be like if she gets a pig as a pet.
Does she know how to open the door, does she?
She does.
Oh, look at that. Oh, that nose. She looks like she's on a mission. Where's she? Oh, look at that. What's in there?
Food. When we first got her, she lived inside for probably about 6 months. She was toilet trained, so she would go in a little mat. And after a while, she just got real strong.
Hey, Nala. Hey, you in your old home. Oh, she's off to the kitchen.
So it just got a little bit too out of control, so we had to pop her outside. She wasn't too impressed at first, but she got used to it.
Oh my God, Nala! Oh my goodness! When Nala first came into the house, I thought, not too bad. And then she decided she wanted to go out that door and bam, she just had the door off its hinges and she was out.
So that was her probably being quite well behaved.
Yeah, I might think about it. I think pigs make great pets, but they really need someone like Ashley to give a lot of love and a lot of patience. Come on, you got this. Come on.
In Bondi, Dr. Kate Adams is trying her best to be cheerful on her morning walk with her beloved golden retriever, Ben.
Bit of energy. You can do it. Come on.
Ben is a battler. 12 months ago, Kate found a lump on his shoulder that turned out to be an aggressive tumour, and he had to undergo 2 major surgeries.
We really had to go in fairly bold and actually take a lot of muscle, and it was pretty hard to see. Underneath that sheet was my dog. I thought that if they could just give me another 12 months, then I would be a very, very happy lady. And I thought, you know what? I've bought him some time and I've been able to give him, hopefully, another year.
Okay, ready, steady, go. Yeah.
Today is bittersweet for Kate. While Ben has made a full recovery from the surgery and looks a picture of health, recent blood tests show his liver enzymes are elevated.
Having high liver enzymes can be nothing. It could be just that he is old, but the fact that this is a change from his regular blood test rings some alarm bells for me. Come on, old mate.
Scared that the cancer has returned, Kate is taking Ben to the Sydney Emergency and Specialist Centre for urgent tests.
Hello, Dr. Kate.
Hello, how are you,
Lovely to see you.
Michael?
Nice to see you.
Nice to see you.
You too as well.
How are you?
Kate is meeting with specialist Dr. Michael Linton.
Please.
Come on, Benjo, let's go. I don't even think of Benny as a dog. I think of him as a family member. He has been with me since he's been about 7 weeks old, and we've pretty much been inseparable ever since. He has been with me through the whole adventure, everywhere from Queensland to the Northern Territory to outback WA, and now he is a Bondi dog. It's really difficult to tell with Ben when he's in pain, and it's really difficult to tell when he is unhappy because of the fact that he never complains. He always says that he's happy, and he does that for me. So, yeah, I feel like I owe him to try.
The previous bloods before the liver enzymes were normal?
Perfectly normal.
Okay. Kate's a very diligent owner, and of course, but obviously a vet, and so she's been keeping an eye on the enzymes, and there has been a change. So I think, given Ben's history, it is a cause of concern.
First today, Ben is going to be given an ultrasound.
The ultrasound allows us to have a look at all of the organs, not just the liver.
Good boy, Ben. Good boy.
The concern is now that, has the cancer come back or has it spread anywhere? And that's something that, we need to check for. So we're looking in the lymph nodes. Also, given the elevation in the liver enzymes, we're going to have a good look at the liver as well. Alrighty.
If this is a return of the cancer, I'd be devastated.
Do you want to get a BP for me?
At the animal hospital in Perth, Peter needs to check a worrying lump on Tabby Cleo. But the young cat is not responding well to the anaesthetic.
So we have a little bit of a problem. The heart rate is dropping. It can be a side effect of the anaesthesia, and we're just making sure that she's not getting too low because obviously she could die. Green is good. She's coming back up now. Yep. Just keep an eye on the ISO.
With Cleo's heart rate stabilised, Peter can finally get started on the surgery.
It does look like it might just be a little tooth mark. You can see the wound that I was suspicious might be there. It's just this tiny little dot here. It does look like it might be a little canine puncture from another cat that could have introduced some bacteria. 1 second.
Suddenly, Cleo is in trouble again.
Her blood pressure's all of a sudden dropped. If she were to suddenly wake up, she would feel everything that's going on and it would be extremely painful for her. I need to give her some extra fluid so that her blood volume expands and we increase her blood pressure. The reason her blood pressure's dropped is more than likely because she's been under anaesthetic a little while now, and the longer you're under anaesthesia, the higher the risks. 0.2. Got another 0.2 there. She's looking like she's a bit more stable now.
Yep.
All right, so I'm pretty happy that this has had a decent clean.
Peter has managed to get Cleo stable again, so he can resume working on the lump.
I'm about to make my incision into Cleo's skin, and I am expecting there to be a bit of blood underneath one of the first layers of muscle. So I will need to make a little incision into that. So just like I thought, an abscess. So all that yellow muck coming out is her body's immune system sending white blood cells to attack foreign cells that are in her body. This has definitely been caused by a cat fight. Another cat has bitten Cleo, and the bacteria from that tooth has been introduced underneath her skin and caused the abscess to form. There's an immense amount of pressure underneath there, and that would have been causing an immense amount of pain for little Cleo. I'm going to flush out this abscess as much as possible. So that swelling that was once all the way out here has significantly decreased. So I am just going to place a couple little sutures in the corners, but we still leave it open that if there is any extra fluid, it will come out through the middle of this surgical wound. We will place a little cover over this to help absorb some of that ooze that's coming out. Once that's done, that should be the end of this procedure and we'll recover her. The two most risky times in anaesthesia is when the animal's going to sleep and when they're waking up. So even though Cleo's surgery is done, she's still not completely out of the woods just yet. He's a nice little cat.
There we go. Beautiful. Okay, we're good. Alrighty. Looks very normal on the left kidney so far.
In Sydney, Kate's dog Ben is undergoing an ultrasound with specialist Michael Linton to see if Ben's cancer has returned.
Okay, I can't see any abnormalities in the bladder. The bladder wall looks nice and thin. Whenever we're treating any of our friends or colleagues with their own pets, it does add another layer to it because, you never want to see someone, suffering. But at the same time, we have a job to do, and our job is to try and work out what's causing Ben's clinical signs. Now we're going to look at his liver, which was obviously a concern of ours.
Michael is looking for any obvious lesions or changes in the texture of Ben's liver.
The liver's not entirely normal, but it doesn't ring true of any obvious infiltrative disease like cancer.
There's no mass on there?
No, not that I can see.
It's like this horrible game of waiting. And where is it going to come back and when is it going to come back?
Next, Michael is moving onto Ben's adrenal gland.
So the adrenal gland on the left side, although it's got a normal shape, it's a little bit larger than a normal adrenal gland. So we'll have to look at the adrenal gland on the other side. So we need to actually roll him over.
Go, matey.
Very good.
Push you down. There you go, Chook.
So I'm looking again at his liver. And again, it has a very similar appearance to what we're looking at on the other side. It's possibly a little bit more coarse than usual, but I can't see any obvious lesions or growths.
Such a good dog.
So, Dr. Kate, we found the other adrenal gland, and this gland is also larger than it would be in a dog with normal adrenal glands. That can be consistent with a condition called Cushing's disease.
Old dogs often have things wrong with them. All you can really actually hope for is that you find something that is treatable. You're okay, I'm right here.
Hey, sweet pea. Little Cleo's starting to get some of her tone back at the moment.
At the animal hospital in Perth, Peter is closely monitoring little Cleo as she wakes up from surgery on a nasty abscess.
She's starting to show the first few signs that she's gaining her reflexes again. What I'm watching for is her to actually take a swallow, even though she's moving her head around. Once she's moving her tongue and she's swallowing, that indicates she has a gag reflex. Hey, sweetie, you gonna have a swallow? There we go. And once she does that, I can remove the tube. Welcome back. Before she all of a sudden becomes aware of her surgical site, and we're going to place the e-collar around her neck, little Cleo is going to have to wear the cone of shame because she's more than likely going to lick her wound and reinfect it. Vet's orders. I don't know if she'll be too impressed with this, but... So she'll recover in here for about an hour or two. When she's a bit more awake, we'll hopefully send her home. Rest up.
Come on, guys. Come on, guys. Good boys.
On the Gold Coast, Good Samaritan Millie has just found 2 strays.
I just found these little guys running on the motorway.
Sure, look at these 2 handsome boys. Do you want to just have a seat or get a vet to come out and help you, okay?
No worries.
Thank you.
Come on. Come on, guys. I was driving home from work and found these 2 running on the side of the road, being on a main highway. I was a bit panicked, but I had to pull over. I'm a massive dog lover, so I had to get them to a safe place. I probably risked my life a little bit, but I think anyone else would probably do the same in the same situation.
Good boy. Yeah, I know. You're right.
Alex is back from her home visit and has come out to meet the runaways.
Hello. Hi, how you going?
Oh, look at you two.
What have you been up to? Hey?
So I just found these 2 guys on the motorway.
On the motorway?
Yes, yes.
Wow.
So I just quickly pulled over and opened my back door and they both hopped straight in.
And they just jumped straight in the car?
Yeah.
Into the safety, really.
Absolutely.
If they're out there on the road, it's a danger to these poor boys, and yet they're unscathed.
Absolutely.
Hopefully we can find their owners. What we'll do is we'll scan them for a microchip. If they've got a chip, we'll call the owner, get in contact with them and hopefully get them safely home.
Wonderful, that would be great.
All right, I'll take them off your hands. We get lots of dogs come into the emergency hospital as strays, but that was such a brave thing to do.
Bye, mate. Yeah, see you, buddy.
You know, we call them Good Samaritans. They really go above and beyond to make sure that dogs like this get safely home.
Oh, hello.
Vet nurse Tara is going to assist Alex with the microchip scanner.
All right, let's see if they've got a chip.
Yeah, cool.
Be able to find out who you belong to. You can really tell these dogs just love affection. They clearly have a very loving home somewhere. We just got to find it. I see so many strays that come in without a microchip, and it makes me so sad because there must be families out there who are really missing them, and there's no way for us to find who those families are. 2 cheeky dogs, a long way from home.
We found the other adrenal gland, and this gland is also larger than normal adrenal glands.
In Sydney, specialist Michael is trying to find out why Kate's beloved old dog Ben has elevated liver enzymes. Kate is scared it's a sign that his cancer has returned.
That can be consistent with inflammation, but can also be consistent with a condition called Cushing's disease. Cushing's disease is when there's an overproduction of the hormones from the adrenal gland. Probably the biggest one is something called cortisol. Cortisol is probably referred to as the stress hormone, and we need it to live. But when we've got excess amounts, there can actually be some serious complications if that's not managed appropriately.
I think that no cancer is really the best news.
Yeah, that's right.
Cushing's disease is something that I can manage. It's something that I can treat, and that is a good thing. Cancer is something I can't. Cushing's is often progressive, so it can really affect an old dog's quality of life, meaning that treatment is really essential. But in older dogs, anything that you can treat and they are going to live is a good diagnosis.
But Ben can't be given the all clear just yet. Michael now wants to do a CT scan to make absolutely sure there is no sign of Ben's earlier cancer.
The CT scan, offers us the most sensitive way to pick up any evidence of return of that tumour in the chest being spread or in the original surgical site.
Good luck, Benny. You'll be fine. I'm feeling really nervous about putting him under.
Good boy.
You've got to watch out for general anaesthetics in older dogs.
Kate won't be able to relax until she knows that Ben is cancer-free.
I feel like a bit of an overprotective mum at this point.
The best case that I'd be hoping to find with Ben is ideally nothing at all. But unfortunately, cancer can hide away. You know, they're tiny little cells, and there is still a chance that it will rear its ugly head again.
I think that if it turns out that this cancer is spread and it's through his lungs and it's something I can't operate on, then I'll make that call fairly early. While he still has all the quality and the happiness that he has now.
All right, let's see if they got a chip.
On the Gold Coast, Alex and Tara are anxious to find the owners of 2 lively young Staffordshire Terriers found running loose on the highway. They're hoping they've been microchipped.
Oh, that sounded promising.
That's one.
Got a chip?
Yeah, we sure do.
Awesome. Let's see if the other boy's got a chip too.
Yeah. Hey.
Ah, 2 from 2. Good job.
I like that. I'll go get some information from the microchip company and I'll let you know who you are.
All right. I think this is the quietest I've seen you boys be. We just keep it like this. That'll be good.
Microchips each have unique numbers, which are recorded on databases that store the owner's contact details.
How'd you go? Yeah, good. So we've got some good news. This lovely man is Max and this naughty little monkey is Chaos.
Chaos. I could see that.
Yeah, so they both come from the same family.
Oh, that's so good. Chaos is a perfect name for this boy. I reckon he's the one who's led everyone astray.
Yeah. Hey, are you the troublemaker? I think you might be.
Got to make a couple of phone calls, I reckon. When you make that call, you'd never know. Sometimes they've had a chip since a puppy and they've gone to a completely different owner or the chip's not registered.
If the owners can't be contacted, Max and Chaos may have to go to an animal shelter until new owners can be found.
But look how friendly they are. That's
So
amazing.
nice, yeah.
They're such sweet dogs.
Good boy.
I'm very tired.
In Sydney, Ben's CT scan is over and it's time for Kate to talk through the results with specialist Michael Linton.
So Kate, so far the preliminary results looks very positive at the moment. There's no evidence of a growth, there's no evidence of return of the lesion. All looking very, very positive.
This is good.
This is as good as we could hope for at this point, absolutely.
Yeah. There is no reoccurrence of the cancer at this stage, which is excellent news. Thank you so much for looking after him. This has been super useful. You know, if Cushing's is the only thing wrong with him, then that is a good thing for me.
That's right.
It's a manageable situation. It means that then I'm not having to deal with cancer.
Absolutely.
It's a good thing.
Hey, mate.
Come on, wakey wake, wakey wake. You can do it. Come on, wake up. Have you been good? Do you want some breakfast? Do you want to go to the park? You don't want to go to the park? No, I'm too tired.
I am feeling so relieved. I feel like I can put this unease about the cancer coming back to rest, even if it's just for another 6 months.
Big hug like this.
This love affair is not quite over yet.
Or are they?
On the Gold Coast, Alex and Tara are using microchip technology to try to locate the owner of Max and Chaos. The 2 boisterous Staffordshire Terriers were found wandering on a busy highway.
All right, let's try and give Julie a call. Hi, is that Julie?
Yeah.
Hey, Julie, it's Dr. Alex Hynes here from the Animal Emergency Service.
Yeah.
Do you have 2 doggies called Max and Chaos?
Yes, I've been looking for them. Are they okay?
They are fine. A lovely lady picked them up. She popped them in her car and she's brought them down to us.
I'm a driver, man, looking for them everywhere. About 2 hours.
Oh, wow, you must have been so worried.
I was. Thank God I got them chipped.
That's a great result. Julie, you'll be happy to see these 2. You can tell from that phone call that they are just trouble, but I think she's just relieved.
Owner Julie hasn't wasted any time coming to get her boys.
When I heard from Animal Emergency, I just thought,
definitely they've been hit by a car.
Hello.
Hi.
Julie, is it?
How are you? And then she's like, oh, they were picked up on the gateway. And I was like, what were you doing on the gateway? How did you get there? I still can't believe it.
Who's that? Where's you been? Hi, Chaos. Where have you been?
The way they play with each other.
So rough.
Yeah. Yes. When you first meet them, you think Max would be the boss.
No. Chaos is the boss.
Yeah.
Yeah.
He makes all the decisions.
Yep. Max is just the follower.
Yeah.
I'm blaming Chaos all the way. He's the troublemaker of the bunch.
Alex has a theory about why the boys ran away.
I noticed they're carrying an extra pair there, both of them.
Yes.
Have you thought about getting them to snip?
They were meant to be done ages ago.
Because I'm thinking maybe they were after a lady. Maybe.
Oh, that's entirely possible.
Tara and I are both on the same page that we think these two boys could definitely benefit from having the snip. They're still going to be personality plus, but it's probably going to settle them down a bit, especially that Chaos.
See you later.
Say bye.
Look who's here, Cleo. It's okay. She's not too happy with me. Look who's here. Look who's here.
In Perth, little Cleo has recovered from surgery, and Peter is happy to report that the lump was an abscess and not cancer.
It's been a long wait. Yeah, I've been a bit worried.
So she's done really well. It's lovely to see Cleo reunite with Cheryl. Cheryl clearly loves Cleo quite a lot. She's got a nice little laceration here from her surgery. She did have one little puncture wound there that looked like where a tooth has probably gone in, so I'd say she has had a little bite from another cat.
Cleo will have to be on antibiotics for the next 10 days to help clear up the infection, and outdoors will be out of bounds.
The best way to prevent Cleo from fighting in the future is to actually keep her indoors. There we go, a bit more safer in there, isn't it, darling? All right, so she's all ready to go home. This is definitely one of the better parts of the job, being able to return a happy, healthy cat to her loving owner.
Yeah, thanks very much, Dr. Pete.
No dramas, my pleasure.
Let's go, Banana, this way.
In Bondi, it's been a week since Kate's dog Ben was confirmed cancer-free.
Good dog, right next to me. Right next.
And a very relieved Kate has been spoiling her special boy.
There we go. I think every day is a Pamper Benny day. Hey, Benny, do you want some dinner? You do? I know the type of cancer he had. I know that grade 3 sarcomas, they don't go away forever. And there's going to come a day where I have to say goodbye to him. And when that happens, I feel like I gave him a really good run. I gave him the best that I possibly could. Do you want one of these? Which one do you want? Do you want this one? Okay.
Tests have confirmed that Ben does have one major health issue, Cushing's disease, which affects the adrenal gland, but can be managed successfully.
Every day is a blessing.
Did you finish yours already? I want this one.
I feel like a really lucky lady to just even have a little bit more time with him.
You're a good dog. You're a good boy, mate.